antiviral drugs to people who are most in need.
I absolutely support PEPFAR, and I will happily work with you to strengthen the program.
Thank you. Senator Bennett.
Thank you, Mr. Chairman. Thank you, Mr. Kennedy, for being here this morning. And I think that, Mr. Chairman, we are truly through the looking glass this morning here in the U.S. Senate, and this committee is being asked to fulfill a really important responsibility, which is to decide whether to confirm Mr. Kennedy to one of the most important healthcare jobs in America. And the reason I think it's so important is for many of the reasons you said in your opening statement, which is that we live in the richest country in the world, and we have some of the worst health outcomes of any industrialized country in the world. We live in the richest country in the world, and we have some of the lowest life expectancy rates of anybody in the industrialized world. I was a school superintendent before I was in this job, Mr. Chairman, and I can tell you that Mr. Kennedy's right, you know, that when I look at the kids in the Denver public schools, if we don't change the way we eat in this country, 40% of them are going to suffer adult diabetes as a result of their diet. These are, and we're, as I said, spending more than any other country in the world, and our families, every single person's constituents in this Senate are facing chronic shortages when it comes to health care. My friend from Texas, Senator Cornyn, has been a champion on mental health care. We have an epidemic, as he knows, across this country in mental health care, partly because of what the massive social media platforms that were sitting behind the President of the United States have inflicted on our children for their profit in the last decade or so. So we have no shortage of challenges to confront, and I even agree with some of the diagnosis of Mr. Kennedy. What is so disturbing to me is that out of 330 million Americans, we're being asked to put somebody in this job who has spent 50 years of his life not honoring the tradition that he talked about at the beginning of this conversation, but peddling in half-truths, peddling in false statements, peddling in theories that, you know, create doubt about whether or not things that we know are safe are unsafe. Not that every vaccine in America is unsafe, not that you can't possibly have an adverse reaction, but that parents and children in my old school district and school districts all over this country would be better off not getting vaccinated than getting vaccinated. Unlike his own children who were vaccinated, unlike the people he invited to his house in Los Angeles for their party who were vaccinated. For everybody else, it's about peddling these half-truths. And he says it with such conviction that you want to believe him. And Mr. Kennedy, I just have there are many, many things in the record, but I hope that you could answer these questions, yes or no. I've tried to ask these in a manner that's faithful to what you actually said, because I didn't want to have a debate about whether you actually said them. So I'm asking you yes or no, Mr. Kennedy. Did you say that COVID-19 was a genetically engineered bioweapon that targets Black and white people, but spared Ashkenazi Jews and Chinese people?
I didn't say it was deliberately targeted. I just quoted an NIH-funded and NIH published study.
Did you say that it targets Black and white people, but spared Ashkenazi Jews?
I quoted a study, Your Honor. I quoted an NIH study that showed that.
I'll take that as a yes. I have to move on, Mr. I have to move on. Did you say that Lyme disease is highly likely a materially engineered bioweapon? I made sure I put in the highly likely. Did you say Lyme disease is a highly likely militarily engineered bioweapon?
I probably did say that.
Did you say that?
And that's what the developer of
I want all of our colleagues to hear it, Mr. Kennedy. I want them to hear it. You said yes. Did you say that exposure to pesticides causes children to become transgender?
No, I never said that.
Okay, I have the record that I'll give to the chairman, and he can make his judgment about what you said. Did you write in your book, and it's undeniable, that African AIDS is an entirely different disease from Western AIDS? Yes or no, Mr. Kennedy?
I'm not sure if I made that.
Okay, I'll give it to the chairman, Mr. Kennedy. And my final question, did this is a job where it is life and death for the kids that I used to work for in the Denver public schools, and for families all over this country that are suffering from living in the richest country of the world that can't deliver basic health care and basic mental health care to them. It's too important for the games that you're playing, Mr. Kennedy. And I hope my colleagues will say to the president, I have no influence over him. I hope my colleagues will say to the president, out of 330 million Americans, we can do better than this.
Thank you. We need to move on. Senator Cassidy.
Mr. Kennedy, President Trump has sworn to protect Medicare. Republicans are exploring reforms to Medicaid that could help pay for Trump administration priorities. With this context, what will you do with dual eligibles?
About,
Dual eligibles.
well, dual eligibles are not right now served very well under the system. Those are people who are eligible for both Medicaid and Medicare. I suppose my answer to that is to make sure that the programs are consolidated, that they're integrated, and the care is integrated. I look forward to working with you, Dr. Cassidy, on making sure that we take good care of people who are dual eligible.
And how do you propose that we integrate those programs? Does Medicare pay more, Medicare pay less, Medicaid pay more, Medicaid pay less? How do we do that?
Well, I'm not exactly sure because I'm not in there. I mean, it is difficult to integrate them because Medicare is under fee-for-service, is paid for by employer taxes. Medicaid is fully paid for by the federal government, and it's not fee-for-service. So I do not know the answer to that. I look forward to exploring options with you.
Republicans, again, are looking at ways to potentially reform Medicaid to help, pay for President Trump's priorities, but to improve outcomes. What thoughts do you have regarding Medicaid reform?
And say,
Well, Medicaid is not working for Americans.
You better do
and
it.
It's specifically not working for the target
I think
population.
I think
Most
you
Americans
better
like myself,
just
I'm
do it.
on Medicare Advantage, and I'm very happy with it. Most people who are on Medicaid are not happy. The premiums are too high. The deductibles are too high. The networks are narrow. The best doctors will not accept it in the best hospitals. And particularly, Medicaid was really designed for a target population, the poorest Americans. It's now been dramatically. And the irony of the expansion is that the poorest Americans are now being robbed. Their services have dramatically decreased, even though we've increased the price of Medicare by 60% over the last 4 years. The target population is being robbed.
With that
We need to
said,
figure out other options.
obviously you've thought about that, and I appreciate that. What reforms do you recommend, again, that would improve services, I suppose, but also make it more cost efficient?
Well, President Trump has given me the charge of improving quality of care and lowering the price of care for all Americans. there are many things that we can do. I mean, what we want to, the ultimate outcome, I think, is to increase transparency, to increase accountability, and to transition to a
So on
other than a
Medicaid,
service basis.
on Medicaid in particular, can you just kind of take those kind of general principles and apply it to the Medicaid program?
You know, I listen, I think that there are many, many options with telemedicine, with AI right now. And, you know, there's including direct primary care systems. We're seeing that movement grow across the country. There's one of the largest providers.
So going back to Medicaid though, and speaking of these specific advances, what reforms are you proposing with these ideas vis-a-vis Medicaid?
Well, I don't have a broad proposal for dismantling the program.
Of course not saying that.
I think what we need to do is we need to experiment with pilot programs in each state. We need to keep our eye on the ultimate goal, which is value-based care, which is transparency, accountability, access.
And one more thing, going back to Medicare, you mentioned you're an MA. You mentioned earlier the Medicare fee for service. Do you have any kind of thoughts as to whether or not patients on fee for service should move into MA, or how should we handle that?
Whether patients
who are on Medicare fee for
on
service.
traditional Medicare,
Yes.
that's their choice right now. Well, I mean, we have, I think, 32 million Americans, or 30 million Americans on Medicare, on traditional Medicare, and then another 34 or 34 on Medicare Advantage, roughly half and half. And I think more people would rather be on Medicare Advantage because it offers very good services. But people can't afford it. It's much more expensive. In answer to your first question, there are all kinds of exciting things that we can be doing, including cooperatives, which President Trump has supported, including health savings accounts, which President Trump has supported. But all of these things to make people more accountable for their own health.
And so we'd bring the cooperatives and the health savings accounts into Medicare and Medicaid?
Exactly. We try to increase those, the use of those, and to direct primary care, to continue to transition into a value-based program that is private. Americans don't, by and large, do not like the Affordable Care Act. People are on it. They don't like Medicaid. They like Medicare. And they like private insurance. We need to listen to what they would prefer to be on private insurance. Most Americans, if they can afford to be, will be on private insurance. We need to figure out ways to improve care, particularly for elderly, for veterans, for the poor in this country. And Medicaid, the current model is not doing that. I would ask, any of the Democrats who are chuckling just now, do you think all that money, the $900 billion that we're sending to Medicaid every year, has made Americans healthy? Do we think it's working for anybody? Are the premiums low enough?
We do need to move on. Senator Warner.
Well, I got to tell you, for literally hundreds of thousands of Virginians, Medicaid is what prevents them from health crises on a daily and weekly basis. And some imaginary new plan, and if there was a new plan that was to be the basis of what Trump was going to do in repealing Obamacare, I would have thought by now we'd have seen it. I got to tell you, listen,
Senator, can I reply to that?
Senator, Mr. Kennedy, I got questions. I appreciate our visit. I know you take your views seriously, and I don't reflexively vote. I voted for 4 of President Trump's nominees already. Got a lot of grief from folks on this panel. But I got to tell you, I saw an email that you put out Monday night, or your campaign did, in a fundraising email. Your presidential campaign celebrated that the freeze on all new regulations, guidance, and announcements is a way to protect unelected bureaucrats from further undermining our health freedom. Then you ask your donors to help pay for your campaign debt. Did your campaign and you put out that?
I don't think my campaign exists anymore.
All right, well,
Senator.
listen, I got to tell you this. Somebody's out there soliciting money for it. Maybe you ought to find out who is. So the fact that you celebrate this freeze, do you think that was a good idea to put all of this on hold for 90 days, funding and any kind of further work, NIH research?
As Chairman Crapo pointed
What do
out,
you, I'm not asking for, I love Mike Crapo. I'm asking you. You're up very, very important position.
as he pointed out, Senator,
All right,
the
let me just-
portals that were closed were not closed as a result of the Trump
Let me just tell you,
administration's
I'd like you to
purposeful
explain, excuse
policy.
me, sir, I'd like you to explain to a domestic violence center in Richmond that's saying because this freeze, they may have to close down, where those battered women to go. Or a rural nonprofit I've got in the Shenandoah Valley who's saying that freeze is going to potentially shut down their ability to operate. So I guess if you deny or don't know what your campaign's sending on, you don't know if you raised a lot of money Monday night with the media.
I'm saying that the Trump
You don't know if
has,
you raised a lot of money.
the Trump administration has made clear that it does not want to freeze benefits
All right,
for
excuse me.
any Americans under Medicaid or Medicare, and I do not want to
There are,
dismantle
the
Medicaid.
freeze is
Either-
affecting beyond Medicare and Social Security. I would hope you would have known that to be able to answer some of this. Now, you've said publicly, you want to immediately get rid of 600 NIH workers on job one, on day one. When we had our meeting, you said you'd actually like to get rid of 2,200 people from HHS. Which offices are you going to start cutting and riffing these 2,200 workers from?
Senator, there's 200 political appointees that are changed during every
So
administration.
if you got rid of those 200 political appointees, you're not going to replace them with your political appointees.
Well, President Biden this year changed 3,000 employees at HHS, 3,750
So
at
your
NIH.
2,200, what departments are you going to pick them from?
Well, the same as President Biden did when he changed 3,000 out.
Let me just,
across all
I'm down to a minute,
departments.
minute 30. The chairman's been generous with colleagues on both sides. I may have to go a couple minutes over, but let me just say, so let's just answer, this would be, this, I hope, since you're asking to become the top healthcare official in the United States in terms of HHS, huge ramifications, and part of this job is to be the senior advisor to the president on health issues. So when we're looking at this purge and we're looking at laying off workers, when we're looking at potentially the president's illegal offer to try to buy out federal employees, which I would say to any federal employees, think twice. Has this individual in his business world ever fulfilled his contracts or obligations to any workers in the past? But if you are in this position, will you pledge that you will not fire federal employees who work on food safety, work on trying to preventing things like salmonella?
Senator, there's 91,000 employees.
So that, I take that as, I
HHS.
take it, that's a simple yes, and I'm going to
You
take
think
that as
I
a
can
no.
Run that
I take that as a
agency
no.
without getting rid of-
Will you, actually, we talked about protecting Americans from cyber criminals, something we need to do a lot more on. Will you commit not to fire anyone in the health arena who currently works on protecting Americans from cyber attacks in their healthcare files?
I will commit to not firing anybody who's doing their job.
There you go.
Based on your opinion, based upon your opinion, or your political agenda, or Mr. Trump's political agenda?
Based upon my opinion.
I guess that means a lot of the folks who've had any type of views on vaccines will be out of work. Will you freeze grant funding for community health centers? Will you freeze federal funds for community health centers, the way the current administration has done?
The White House has made clear that no funds are going to be denied to any American for benefits in any program.
Do you know what happens at community health centers? Those are direct.
Are you talking about the Indian health centers?
No, I'm talking about community health centers across the country.
I understand that. I mean, I strongly
So you're going to
support.
excuse Indian health centers, which is good, but others are not. They're going to get their funds frozen.
I strongly support community health centers, as does the president. He's
Does that
not
mean
one.
you're not going to freeze the funding that is currently frozen?
The White
We're
House
done
has made
freezing?
clear that none of that funding is supposed to be frozen.
Sir, the direct payments are different than how the government operates. We fund the federal government down to community health centers. As a former governor, there's lots and lots of state programs that are related to healthcare that come from the federal government. They come down to the state, then it goes to local programs. All of those don't directly pay out $1 at a time, but they come from federal funding. They are all, even though they keep changing the guidance on a minute-by-minute basis, based upon 9:45 or 10:30 or 10:45, whatever time it is today, those funds are still frozen. Sir, I just honestly, I want to give you a fair shot, but I don't feel like you approach this job with the knowledge and candidly your willingness not to commit, try to recommend to the president to make sure these funds are unfrozen and that people's lives are at stake is a very disappointing answer. Thank you, Mr. Chairman.
Senator Langford.
Chairman, thank you.
Michelle, please.
Mr. Kennedy, it's good to see you again. We had some great visits in my office. We've done some follow-up calls to be able to go through. You and I have talked about 100 different issues and backgrounds and things. You've been able to address a lot of them today and just different questions to be able to clear up social media rumors and the things that are out there on it. So I do appreciate that. We've talked about pharmacy benefit managers. We've talked about the nursing home rule the Biden administration put down. We talked about your views on agriculture and commercial and row crop agriculture. We've talked about food issues, and you made it very, very clear. You're not going to tell Americans what to eat, but you do want Americans to know what they're eating. And I think that's a pretty fair perspective on that. I do want to talk to you about some areas that you and I have talked about as well. We have some disagreements, you and I, on the issue of life and when life begins on that. You've been very outspoken on that, and we've had some good opportunities to be able to talk about that. Title 10 is specifically in the HHS area. This is an area that has been interpreted for a long time, and President Trump in the first administration interpreted that rule to say that his administration will prohibit the performance, referral for, or promotion of abortion as a part of the Title 10 program. That he made that very clear in the first administration. Obviously, that's his decision to make again on that, on how he wants to handle that, and he's made a lot of public statements on that. The Biden administration not only reversed that, not only rescinded that rule, but they went one step the other direction. In my state in Oklahoma, as you and I have talked about, the Biden administration cut off funding to the state of Oklahoma for AIDS testing, for breast cancer screening, and for other areas of poverty healthcare because my state didn't promote abortion. It wouldn't provide. If my state wouldn't promote abortion in the state, we got cut off for federal funds for AIDS testing and for other things. My simple question to you is, how are you going to handle Title 10 on that? I saw how President Biden handled that in the punitive measures that came on my state for those that are in rural health care. How are you going to handle Title 10?
I'm going to support President Trump's policies on Title 10. I agree with President Trump that every abortion is a tragedy. I agree with him that we cannot be a moral nation if we have 1.2 million abortions a year. I agree with him that the states should control abortion. President Trump has told me that he wants to end late-term abortions, and he wants to protect conscious exemptions, and that he wants to end federal funding for abortions here or abroad. That's Title 10. I serve at the pleasure of the president. I'm going to implement his policies.
Thank you for that. President Biden, when he came in, immediately closed down the Office of Civil Rights and Conscience Protections within HHS. There's a statement that's come out recently that he's going to reopen that office again to be able to protect the civil rights of Americans. One of the things that Javier Becerra did immediately when he came into HHS was conscience protections for medical professionals that were being compelled against their conscience to perform medical procedures that violated their conscience. Javier Becerra stepped in immediately into HHS and withdrew that and said, no, the federal government will tell you what you believe about these issues. You don't have conscience protections anymore, and refuse to protect those folks. Will you step in and say that healthcare individuals have the right of conscience again, as the federal law allows?
Yeah, I mean, the first thing that occurs to me when you ask that question is, what patient would want somebody doing a surgery on them that, believes that the surgery is against their conscience being forced to perform that? I don't know anybody who would want to have a doctor performing a surgery that the doctor is morally opposed to. Listen, I came from a family that was split on life and choice. I have cousins today who believe that abortion at any stage is equivalent to homicide. Now, there are other people who believe the opposite. But the good thing in my family that I really loved is that we were able to have those conversations and respect each other. And I wish that we could do that nationally. And if forcing somebody to participate in a medical procedure as a provider that they believe is murder does not make any sense to me. We need to welcome diversity in this country. We need to respect diversity. And we need to respect each other when we have different opinions and not force our opinions on other people.
Yeah, thank you for that. The FDA, under the Biden administration, changed the rules for the chemical abortion drug and said you no longer need to see a physician. So if you have an ectopic pregnancy or all kinds of, don't even go anymore to see a physician. But they also changed an area that has been, something that's been very particular, you've talked about a lot, and that's transparency. They changed the position and said, don't tell us if there's a side effect in this drug unless she dies. Other than that, don't tell us anymore. Literally don't give transparent information to the American people or to the women who take this drug anymore. We don't want that reported. My question to you is, will FDA move to be able to actually give transparency to the American people and to say, this drug is no different than any other drug. We're not going to protect it just because it's political for some folks. People should know side effects on this drug and there should be reporting.
Yeah, I mean, it's against everything we believe in this country that patients or doctors should not be reporting adverse events. We need to know what adverse events are. We need to understand the safety of every drug, mifepristone and every other drug. And President Trump has made it clear to me that one of the things he is not taking a position yet on mifepristone, a detailed position, but he's made it clear to me that he wants me to look at the safety issues. And I'll ask NIH and FDA to do that.
Thank you.
Senator Whitehouse.
Thank you, Chairman. Mr. Kennedy, I only have 5 minutes with you, and I've got a lot of experience with CMS, so you're just going to have to listen. Two things. One, if you want to move from advocacy to public responsibility, Americans are going to need to hear a clear and trustworthy recantation of what you have said on vaccinations, including a promise from you never to say vaccines aren't medically safe when they in fact are, and making indisputably clear that you support mandatory vaccinations against diseases where that will keep people safe. You're in that hole pretty deep. We've just had a measles case in Rhode Island, the first since 2013. And frankly, you frighten people. Two, I want to air harms that Rhode Island has experienced from a remorseless, senseless CMS bureaucracy. CMS has for years maintained a reimbursement system that the bureaucracy could never explain, never justify, that persistently pays Rhode Island providers less than neighboring Massachusetts and Connecticut providers. A differential of 23 and 26% in our regional healthcare market. The Pending Ahead program can begin to remedy this, at least for value-based care, and it must. There has to be payment parity in the region. Rhode Island's healthcare system is bleeding out because we aren't paid what neighboring hospitals and doctors are paid. And the one act CMS took on this years ago was to make it worse. The CMS bureaucracy has also attacked one of the best accountable care organizations in the country, Rhode Island's Integra family doctors tried to throw them off the shared savings program because they said Integra years ago briefly fell 137 patients short of the 5,000 patients that ACOs need. CMS wouldn't listen until a court found that to be unjustified, likely illegal, irreparable harm to this high-performing ACO and patients, and contrary to the public interest. That must stop. Last, CMS has refused to approve waivers granted elsewhere for Rhode Island from rules that are stupid for Medicare patients who are nearing the end of their days. Here's what families see. Granny is home dying. She needs to transfer to a nursing home, and Medicare insists on putting her 3 days and 2 nights in a hospital. Expensive, frightening to Granny and the family, and stupid. Granny's home dying and can't get palliative and curative care together. Inhumane and stupid. Granny's home dying and can't get home care if she can still get out into the yard or be driven to see the shore, to see Narragansett Beach, say, one more time, to recall childhood memories before she dies. Inhumane and stupid. Granny's home dying and the family's exhausted. And the respite care benefit is not to send a nurse or a caregiver, but to stuff Granny in an ambulance and haul her off to a hospital. Some respite. It's all expensive, frightening, inhumane, and stupid. But the insensate CMS bureaucracy takes a court order to be awakened to the harm they cause. I have had enough. CMS should let Rhode Island try humane end-of-life care through CMMI. Let's see if it works at a state. I bet it will save money, serve families better at a very, very delicate time, and perhaps even make a model for better health care everywhere. I've said a lot. My time is out. You're welcome to respond in writing. I ask unanimous consent that the order declaring CMS's actions to constitute irreparable and illegal harm be put into the record.
Without objection.
Let me just respond very briefly, Senator Whitehouse. I'm an implacable enemy of tyrannical, insensate bureaucracies and stupid rules, and I will work with you to make CMS responsive to the needs of Rhode Island and to remedy those disparities that you talk about. I am familiar with the Integra Health plan, and it is the template for what we ought to be doing in a value-based plan. And I look forward to you to making sure that we create pilot programs like this.
Unfortunately, Mr. Chairman,
around the country.
Unfortunately, Mr. Chairman, one of the things I've learned in my tenure in the Senate is that a nominee saying that they're willing to work with me amounts to exactly zero. We need to get this fixed. Thank you.
Well, I guess at that point, then we will move on to Senator Daines.
Mr. Chairman, thank you. Mr. Kennedy, I'm glad to see you here this morning. I listened to your opening remarks, and you mentioned that you want to make HHS the gold standard of science. I have found my engagements with you, both behind closed doors in my office, as well as listening to you publicly, to be very thoughtful and science-based. I applaud that. I thank you for that. And I realize this will likely be a very partisan vote on this committee and on the Senate floor. But let the record state there are 3 medical doctors on this side of the dais. I'm a chemical engineer. We believe in science. I'm thankful that you do too, and you made that comment in your opening remarks. I want to talk about agriculture for a moment. We talked about our common love for Montana. You've been to Montana many times. It's a wonderful state. A lot of folks have discovered it. They watch the show Yellowstone, and people are coming and moving into our state, but it's an amazing place. But as you know, agriculture is our top economic driver in Montana. We produce some of the highest quality crops, the best livestock in the country and the world. Our farmers and our ranchers are truly some of the most effective environmental stewards in ensuring we have a safe food supply chain in the world. I share your view that protecting the integrity and safety of our food supply is of utmost importance. I appreciate the research happening in places like Montana State University to help farmers produce resilient, healthy, and safe crops, as well as their agricultural practices. You mentioned you were a 4-H kid growing up. I think our 4-H kids and our FFA kids are some of the best kids in America. My question for you, Mr. Kennedy, is if confirmed, as I'm listening to my farmers and ranchers talk about the future, will you commit to working collaboratively with partners at USDA, at the relevant federal agencies, as well as our Montana farmers and ranchers before implementing any policy that might affect or impact food supply?
I absolutely will make that commitment. I have, as I shared with you, a personal commitment and a long career working with farmers. I want to make sure I understand the very, very narrow margins, the slim margins that American farmers and ranchers are dealing with. And I don't want under my watch a single farmer to have to leave his farm for economic reasons or for regulatory or bureaucratic reasons while I serve, if I'm privileged to serve, to be confirmed as HHS Secretary. Even more important, President Trump had a very, very strong commitment to farmers. President Trump is probably historically in modern history the best farm president in our history. Farm income spiked for the first time in decades under his last administration. He got solid support from farmers across the country. Farm country is Trump country. Farmers across the country supported him during this election. He has specifically instructed me that he wants farmers involved in every policy and that he wants me to work with Brooke Rollins at USDA to make sure that we preserve American farmers, that all of our policies support them.
Mr. Kennedy, thank you. And if confirmed, I look forward to having you and Brooke Rollins out to Montana to spend some time with
You
us.
have my commitment to come there anytime, particularly during ski season or hunting season.
Deal. I want to shift gears for a moment. As we discussed in the meeting we had in my office, mifepristone was approved in 2000. The FDA has been under scrutiny and brought to court for failure to properly assess this drug, as well as subsequent deregulations Senator Langford described that have occurred over the past 25 years. Some of these deregulations included ending the requirement that these drugs be prescribed by a doctor, ending reporting requirements for adverse events, and allowing these pills to be obtained through the mail. In fact, the FDA's own prescribing label mentioned that 3 to 5% of women taking this drug end up in the emergency room. My question is, if confirmed as Secretary of HHS, will you commit to working with the FDA Commission to review these deregulatory actions that are threatening the safety of women?
Sorry, Senator. As I said to Senator Langford, I think it's immoral to have a policy where patients are not allowed to report adverse events and where doctors are discouraged from doing that. President Trump has asked me to study the safety of mifepristone. He has not yet taken a stand on how to regulate it. Whatever he does, I will implement those policies, and I will work with this committee, make those policies make sense.
Thank you, Mr. Kennedy.
Senator Hassan.
Thank you, Mr. Chair and Ranking Member Wyden, and welcome, Mr. Kennedy, and to your family as well. I want to start with a couple of concerns I have, and just briefly on Medicaid. States share in the funding of Medicaid. Millions of disabled children in this country are alive because of Medicaid. Millions of people with addiction in this country are in recovery because of the services provided to them by Medicaid. And millions of chronically ill people who, until Medicaid expansion was enacted, who couldn't get health care and therefore couldn't work because they were too sick, got health care through Medicaid expansion, then went back to work, and now they're on private insurance. So those are some facts about Medicaid that you might want to brush up on. Now, I'm also extremely concerned about your endorsement of radical fringe conspiracies that, if implemented at HHS,
We're not doing that.
would put American families' lives at risks. Vaccines are one of our greatest public health triumphs. And you don't need, I'm not talking about abstract medical science. One of the people who helped raise me was my grandfather, who was a pediatrician. He practiced medicine in this country from 1921 until the mid-1980s. And I heard details about the difference those vaccines made in saving lives in the children who were under his care. Vaccination has helped to eradicate many deadly diseases in the United States, including polio and smallpox, something we should be proud of as Americans. I am extremely concerned that as Secretary, you would be able to halt critical vaccine research and to exploit parents' natural worries by advising them not to vaccinate their children. This will lead to more children getting sick, and some will even die. Before the measles vaccine, about 500 American children died a year from measles. This is too much of a risk for our country, and there is no reason that any of us should believe that you have reversed the anti-vaccine views that you have promoted for 25 years. For example, you have previously falsely suggested that the polio vaccine killed many, 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 many more people than polio ever did by causing fatal cancers, while rigorous safety studies show that to be completely false. Now, let's go to something we agree upon. I am really heartened to see that one area where we agree on is on women's reproductive freedom. In your own words, it's not the government's place to tell people what to do with their bodies. You said that, correct?
He's contradicting us, though.
Yeah. Mr. Kennedy, in 2023, you came to New Hampshire and said, quote, "I'm pro-choice. I don't think the government has any business telling people what they can or cannot do with their body." So you said that, right?
Yes.
Yep. But you also said we need to trust the women to make that choice because I don't trust government to make any choices. You said that too, right?
Yes.
It is remarkable that you have such a long record of fighting for women's reproductive freedom, and really great that my Republican colleagues are so open to voting for a pro-choice HHS secretary. So, Mr. Kennedy, I'm confused. You have clearly stated in the past that bodily autonomy is one of your core values. The question is, do you stand for that value or not? When was it that you decided to sell out the values you've had your whole life in order to be given power by President Trump?
Senator, I agree with President Trump that every abortion is a tragedy, that we can't be a moral authority in this country.
Right, so, but that isn't what you said back in New Hampshire in 2023. My question is exactly when did you decide to sell out your life's work and values to get this position?
Senator,
Out
I
loud.
agree with President Trump that every abortion is a tragedy.
So what you're telling us, just to be clear, because my time is limited, is that regardless of what you believe, regardless of what values you have, if President Trump tells you to do something, you're going to do it.
This is
You
so
said just now
manipulative.
the discussion about mifepristone. Oh, he's asked me to study the safety of it. Here are the safety studies that tell us mifepristone is safe and effective. And I asked Mr. Chair that these about 40 studies be admitted to the record by unanimous consent.
Without objection.
So the studies are there. The safety is proved. The science is there. But what you're telling us is if President Trump orders you to take action to make it harder for women to get direly needed health care, you'll follow his order. If Mr. Trump, as he did yesterday, orders a halt on Medicaid payments that are essential for taking care of people with disabilities all around this country, you're going to follow that order because you are willing to sacrifice your values, your knowledge, if President Trump tells you to do that. That, to me, is unacceptable in a Secretary of Health and Human Services.
As I explained before, the White House has issued
Where's your brother?
a statement
Where is he?
saying that that policy will not deprive any American.
Yeah, the problem is the White House issued that statement only after we pointed out the damage it would do, and it became politically uncomfortable for them. You know what else that freeze on federal funding did? It halted funds for critical research that could cure pediatric cancer. So if the president tells you to do that, you're going to stop that too. That's enough.
Thank you. Senator Cortez Masto is next.
Thank you. Mr. Kennedy, thank you for coming into my office and having the conversation that we did. I appreciate your passion and your belief, and you've spent years really talking about the issues that matter to you, and I appreciate that. Let me ask you a couple of questions, though I just need some clarification. Right now, there's a 40-year-old law that requires hospital ERs accepting payment from Medicare to actually provide emergency care to patients. So let's say a woman experiencing a life-threatening condition like a heart attack goes to the ER. As a lawyer, you would agree that that federal law protects her right to emergency care, correct?
Yes.
So now a pregnant woman with life-threatening bleeding from an incomplete miscarriage goes to the ER. Let me rephrase that so you can hear. A pregnant woman with a life-threatening bleeding from an incomplete miscarriage goes to the ER, and her doctor also determines that she needs an emergency abortion. But she's in a state where abortion is banned. You would agree also as an attorney that federal law protects her right to that emergency care, correct?
I don't know. I mean, the answer to that is I don't know. If the state
Does it,
bans
well, let me ask you this as an attorney, doesn't federal law preempt state law?
the federal Constitution does. Sometimes not every federal law preempts state laws. It could be unconstitutional. Now, I'm
Well,
not
I
trying
would
to
tell
be
you in this
evasive,
case, let me ask you
Senator. I'm
this.
just telling you I don't know the
I
answer to
appreciate that.
question.
But what authority do you have over this as the director of HHS
What authority do I have?
to enforce the law?
In what regards?
To make sure that a hospital that receives payment from Medicare is ensuring that they're providing the necessary emergency care to patients when they present. It's actually the EMTALA law. So what authority as HHS director do you have with respect to EMTALA?
My understanding is that I have budgetary power and that it's pretty much limited to that. But if you tell me I have another authority, I don't even think that
Well, let me tell you,
we
you
have a
do.
law enforcement branch at HHS.
Actually, you do, and that's CMS. CMS actually investigates complaints of EMTALA violations, as well as the Health and Human Services Inspector General, who, by the way, was just recently fired by Donald Trump. So you will be enforcing EMTALA laws, and it's important that you understand their impact and don't play politics with the patient presenting at the ER based on a position that this administration has taken. Let me ask you another question. When we met in my office, you said about lowering drug prices, that when Big Pharma price gouges, the American people suffer. I think we both agree on that. And I think you're sincere in your belief that you want to reduce prices for Americans, correct?
Yes.
Yeah. The Inflation Reduction Act empowered Medicare to negotiate prescription drug prices. It penalizes drug companies for price hikes above inflation, and it caps seniors' out-of-pocket drug costs, along with reducing insulin prices to $35 per month. But your future boss, Donald Trump, on his first day in office, revoked President Biden's executive order that actually directed the health secretary to examine ways to reduce drug prices and improve access to innovative therapies for the American people. And unfortunately, Republicans in Congress to repeal the Inflation Reduction Act, which means reversing all of those things that we worked on to lower prices for Americans. So my question to you is, what do you do? Why are you there? Are you there to be a rubber stamp to this administration and cave into all of these positions that they're taking, even though you know they're in disagreement with your positions on lowering drug prices and that they could harm Americans? How do you handle that as HHS director?
Senator, my understanding is that the White House issued an executive order, I believe today, supporting the drug negotiations under the IRA. President Trump was very aggressive during his first term about negotiating drug prices. He has instructed me, and I've met with him repeatedly on as that we need lower prices than seniors in this country, and
So let me ask
others
you,
are.
let me ask you this, because I only have so much time. So we've already negotiated lowering prices for 10 drugs with Big Pharma. And Big Pharma, by the way, opposes this. They have not only are asking for a pause, they have filed lawsuits, but we've already negotiated the first 10 drugs.
Let's move on.
And we want to expand it to the next 10 to 15 that the Biden administration has put forward. Would you agree and continue that path of really mandating that Big Pharma come to the table and negotiate drug prices for Medicare so we can lower those prices for Americans?
My understanding is that the executive order that was issued today, which I haven't seen, but I've read a summary.
Well, let me ask you this then, because you keep citing the Trump administration and you're just going to follow what they say. Is that what you're doing? You're just a rubber stamp for them in this position? So anybody, so it doesn't matter that you're before us. It could be anybody coming before us as long as they're a rubber stamp for this administration and disregarding your beliefs and what you think. I guess my question to you is, if it really is fundamental to what you believe, how do you live with that? How do you address those issues moving forward,
You want me to
knowing
answer
that
the
it's going to
question,
harm
Senator?
Americans? Yeah.
You want me to answer the question?
No, I'm asking you.
Okay. President Trump has asked me to end the chronic disease epidemic and make America healthy again. And I'm
So
in a
is that the
unique
only reason why
position.
you're at HHS? Is that the
Excuse
only
me?
reason why then you're at the HHS to address that one issue?
President Trump has asked me because I'm in a unique position to end that. And that is what I'm doing. And if we don't solve that problem, Senator, all of the other disputes we have about who's paying and whether it's insurance companies, whether it's providers, whether it's HMOs, whether it's patients or families, all of those are moving deck chairs around on the Titanic. Our ship is sinking. Our 60% increase in Medicaid over the past 4 years is the biggest budget line now, and it's growing faster than any other. And no other nation in the world has what we have here. No other nation has a chronic disease. We have the highest chronic disease burden of any country in the world. We had, during COVID, we had 16% of the COVID deaths in a country. We only have 4.2% of the world's population. We had a higher death count than any country in the world. And when CDC was asked why, they said it's because Americans are the sickest people on earth. The average person who died from COVID, American, had 3.8 chronic diseases. This is an existential threat economically to our military, to our health, to our sense of well-being. And it is a priority for President Trump. And that's why he asked me to run the agency. And if I'm privileged to be confirmed, that's exactly what I'll do.
Senator Barrasso.
Thanks so much, Mr. Chairman. Mr. Kennedy, thank you for taking time to visit with me in my office prior to today's hearing to talk about a lot of the important issues affecting healthcare in my home state of Wyoming, as well as the nation. I appreciate your willingness to serve our country. During our meeting, we discussed the challenges that healthcare providers and patients are facing in rural America, financial obstacles facing rural hospitals, workforce shortages, issues of OBGYN, and then new regulations that are painful that have come out of the Biden administration, hurting our ability to provide nursing home staffing. So let me start, if I could, with rural hospitals and the closures of hospitals like that. There are a lot of challenges facing hospitals in rural communities and frontier areas. We have 33 hospitals in Wyoming. 26 are really located in various locations, often hard to get to. Weather impacts them. 6 of the hospitals are at risk of closing. 2 are at immediate risk of closing in the next 2 years. 10 have had to cut available services and this is a concern of rural hospitals, both Republican and Democrat states, either way, bipartisan, critical that the workforce challenges, financial challenges that we're facing are addressed. Can you commit to working with us on a plan to address the critical nationwide issue of rural health care?
Yes, yes, Senator. And I would say that during my visits, I visited almost 60 senators so far. And the most common unifying, I would say, issue among both Democrats and Republicans, there were two. One was PBM reform, and the other is rural hospitals. And, our nation made a commitment over 100 years ago to put a hospital within 30 miles of every American. We generally succeeded in doing that. It's absolutely critical. It's life-saving. And rural hospitals are closing at an extraordinary rate right now. They not only provide important health care for the localities, but also they're economic drivers for localities all over this country. President Trump is determined to end hemorrhage of rural hospitals, and he's asked me to do that through the use of AI, through telemedicine, which these are innovations that I saw the other day. A Cleveland clinic has developed an AI nurse that you cannot distinguish from a human being, that has diagnostics as good as any doctor. And we can provide concierge care to every American in this country, even those, the remote parts of Wyoming, Montana, Alaska, et cetera. We also have opportunities at HRSA and at the GME to finally live up to GME's mission of providing personnel to rural hospitals. And I intend to use all of my power, because I've seen the priority that is given by both Democrats and Republicans on this committee. I intend to make that a priority if I'm privileged to be confirmed.
Well, I appreciate it, because often with financial strains on a local hospital, one of the common services to be cut in rural hospitals and maternity services. And now we have women in Wyoming having to drive over 100 miles to access care. 13 counties in Wyoming don't have access to OB. And we're talking counties larger than the states of Vermont, New Hampshire, Rhode Island, Connecticut, New Jersey, Delaware, counties larger than those whole states. So will you commit to working with my office to find solutions to help address these specific maternal health challenges in rural America?
Yes, Senator, I look forward to it.
Another issue we specifically spoke about with this harmful Biden administration rule that have really been bad for our rural nursing homes. And it's a rule that would triple the registered nurse requirements in nursing homes. This is going to lead, there just aren't enough registered nurses in our state to be able to comply with this. This would lead to nursing home closures across our state. Will you commit to working with me to fix this serious problem as a result of a rule that came out by the Biden administration, who clearly doesn't understand rural America?
Yes, Senator, I think the rule was well-intentioned, but as you've said, and I've heard from many rural senators, it will be a disaster for their states. Some of the nursing homes, these are staffing rules that require 24-hour staffing by medical professionals. Some of the nursing homes in rural areas simply do not have the available personnel or the economics to be able to do that. It will mean the closure of nursing homes in rural areas across our country, which means the parents, the elderly parent, will be moved a great distance from the local community and their family. And we know that the single greatest driver of high quality nursing home care is the involvement, the proximity of family members. When you move that nursing facility away from the community where the kids live, you're going to get much worse care. So the intention, although it was noble, was in reality, for rural areas at least, it is going to be a disaster.
Thank you. Thank you, Mr. Chairman.
Thank you. Senator Johnson.
Mr. Kennedy, welcome. Thank you for being here. Thank you for your decades-long advocacy for a clean environment, for children's health. I can't say as I'm surprised by the hostility on the other side. I'm highly disappointed in it. I don't know if you remember when you called me up and you were contemplating setting your political differences aside, joining forces with President Trump on an area of agreement, addressing chronic illness, trying to find the root cause of all these problems facing this nation. My first response was, Bobby, this is an answer to my prayers. We need to get to the answers of this, but even more, we need to heal and unify this divided nation. I'm not necessarily the most optimistic guy because we've got enormous challenges facing this nation, but I thought, wow, here's somebody from the left, somebody I don't agree with on many issues politically, coming together with President Trump and focusing on an area of agreement, something that the American people desperately want. Finding out the answers. What has caused autism? What is causing chronic illness? Ms. Kennedy, I think I've come to know what's in your heart. I think I know the personal and political price you've paid for this decision. I want to say publicly, I thank you for that. I truly appreciate what you're doing here. Can't we come together as a nation and do this? Can we do? Aren't you getting tired of this? I'm getting tired of this. So again, Ms. Kennedy, I need to enter in the record. These are just 11 letters of support signed by 63,000 people, thousands of doctors. From the American Association of American Physicians and Surgeons, Independent Medical Alliance, the North Carolina Physicians and Freedom Group, Governor Jeff Landry from Louisiana. These are Americans, nonpartisan. A lot of these people I know because I've advocated with you. A lot of them are Democrats. They put their political differences aside. So, Mr. Chairman, I'd like to enter this in the record.
Without objection.
I also do want to, Mr. Kennedy, as long as I have you here, I've written over 70 oversight letters to the federal health agencies under the Biden administration. I've virtually gotten squat them, okay? What I get is we get, for example, 50 pages of Anthony Fauci's emails redacted. Oh, by the way, the latest one was 17 pages. Instead of issuing a health alert on the myocarditis they knew was impacting young men early in 2021, instead of issuing an alert on the Health Alert Network, they developed 17 pages of talking points. This was given to the public under a FOIA request. They had to go to court. They've got a new way of redacting. They don't black things out. They just give you white pages. So you don't even know what they have redacted. So again, I've issued a subpoena now to cover the information I've requested in 70 oversight letters. My question to you is, as Secretary of HHS, will you honor these requests from Congress and will you make HHS transparent?
Yeah, my approach to HHS, as I said before, Senator, is radical transparency. Democrats and Republicans ought to be able to come in and get information that was generated at taxpayer expense, that is owned by the American taxpayer. They shouldn't get redacted documents. Public health agencies should be transparent. And if we want Americans to restore trust in the public health agencies, we need transparency. I want to say something about what you first said. When I launched my campaign, it was about uniting Americans, Democrats and Republicans. There's no issue that should unite us more than this chronic health epidemic. There's no such thing as Republican children or Democratic children. These are our kids. 66% of them are damaged. I know what a healthy kid looks like because I had so many of them in my family. I didn't know any of the food allergy growing up, peanut allergy. Why do 5 of my kids have allergies? Why are we seeing these explosions in diabetes, rheumatoid arthritis, neurological diseases, depression? all these things that are related to toxics in the environment. Why can't we just agree with each other to put differences about so many issues, intractable issues aside, and say, we're going to end this? I don't think anybody is going to be able to do this like I have because of my peculiar experience, because I've litigated against these agencies. When you litigate against them, you get a PhD in corporate capture and how to unravel it. I've written 6 books about these agencies. I know a lot about them and I know how to fix it. And there's nobody who will fix it the way that I do because I'm not scared of vested interests. I don't care. I'm not here because I want a position or a job. I have a very good life and a happy family. This is something I don't need. I want to do this because we're going to fix it. And the other thing is we are attracting now a caliber of people to HHS like never before in history. And they're entrepreneurs, they're disruptors, they're innovators of immense talent that are walking away, many of them from growing concerns. They're not coming there for position. They're coming there because they want to save our country. And they're from across the political spectrum. And all these Democrats are opposed to me for partisan issues. They used to be my friends, agreed with me on all the environmental issues that I've been working on for my whole career. Now they're against me because anything that President Trump does, any decision he makes, has to be lampooned, derided, discredited, marginalized, vilified.
We need to move on. Senator Warren.
Thank you, Mr. Chairman. So, Mr. Kennedy, I want to start with something that I think you and I agree on, and that is that Big Pharma has too much power in Washington. You've said that President Trump asked you to, quote, clean up corruption and conflicts. Sounds great. You've said that you will, quote, slam shut the revolving door between government agencies and the companies they regulate. That also sounds great. So here's an easy question. Will you commit that when you leave this job, you will not accept compensation from a drug company, a medical device company, a hospital system, or a health insurer for at least 4 years, including as a lobbyist or a board member?
Can you just repeat the last part of the question? Can I commit
You're
to
not
what?
going to take money from drug companies in any way, shape, or form.
Who? Me?
Yes, you.
Oh, yeah, I'm
You're the
happy
one-
to commit to that.
Okay, good. That's what I figured. I said it's an easy question to start with. And I think you're right on this.
I don't think any of them want to give me money, by the way.
Right. Let's keep going. You're right, because to say yes, because every American has the right to know that every decision you make as our #1 health officer is to help them and not to make money for yourself in the future. So I want to talk more about money. I'm looking at your paperwork right now. In the past 2 years, you've raked in $2.5 million from a law firm called Wisner Baum. You go online, you do commercials to encourage people to sign up with Wisner Baum to join lawsuits against vaccine makers. And for everyone who signs up, you personally get paid. And if they win their case, you get 10% of what they win. So if you bring in somebody who gets $10 million, you walk away with $1 million. Now, you just said that you want the American people to know you can't be bought. Your decisions won't depend on how much money you could make in the future. You won't go to work for a drug company after you leave HHS. But you and I both know there's another way to make money. So, Mr. Kennedy, will you also agree that you won't take any compensation from any lawsuits against drug companies while you are secretary and for 4 years afterwards?
Well, I'll certainly commit to that while I'm secretary. But I do want to clarify something because you're making me sound like a shill. I put
You're the
together
one who
that
got-
case. I did the Science Day presentation to the judge on that case to get it into court, the
Mr.
Daubert
Kennedy,
hearing.
Mr. Kennedy, it's just a really simple question.
Yeah,
You've taken in $2.5 million. I want to know if you will commit right now that not only will you not go to work for drug companies, you won't go to work suing the drug companies and taking your rake out of that while you're a secretary and for 4 years after. It's just,
I'll commit to not taking any fees from drug companies while I'm secretary.
I'm asking about fees from suing drug companies. Will you agree not to do that?
You're asking me to not sue drug companies,
No,
and I'm
you
not
can
going to agree
sue
to that,
drug
Senator.
companies as much as you want.
I'm not going to agree to not sue drug companies or anybody.
So let's do a quick count here of how, as Secretary of HHS, if you get confirmed, you could influence every one of those lawsuits. Well, let me start the list. You could publish your anti-vaccine conspiracies, but this time on U.S. government letterhead, something a jury might be impressed by. You could appoint
I
people
don't
to the
understand that.
CDC vaccine panel who share your anti-vax views and let them do your dirty work. You could tell the CDC vaccine panel to remove a particular vaccine from the vaccine schedule. You could remove vaccines from special compensation programs, which would open up manufacturers to mass torts. You could make more injuries eligible for compensation, even if there is no causal evidence. You could change vaccine court processes to make it easier to bring junk lawsuits. You could turn over FDA data to your friends.
All
at the
she's
law firm,
doing
and they could
is
use it however it
covering up
benefited them.
for
You could change.
the government and these people who are not held liable. That's all she cares about. She don't care about the fact that he's actually a victim. He's saying that he lost his voice because of, I think, a flu shot. Yeah, a flu shot. That's what he said, allegedly. And look how stupid I gotta talk.
In every one of those lawsuits so that what you do as secretary will also benefit you financially down the line.
I'll comply with all the ethical guidelines.
That's not the question. You and I, you have said
You're asking me,
repeatedly,
Senator, you're
ethics
asking me not to sue vaccine pharmaceutical
I am
companies.
not. My
Yeah, you
question
are.
is stop
That's exactly what you're doing.
health. Look,
Yes,
no
that
one
is
should be
exactly
fooled
what she's
here.
doing.
As Secretary of HHS, Robert Kennedy will have the power to undercut vaccines and vaccine manufacturing across our country. And for all of his talk about follow the science and his promise that he won't interfere with those of us who want to vaccinate his kids, the bottom line is the same. Kennedy can kill off access to vaccines and make millions of dollars while he does it. Kids might die, but Robert Kennedy can keep cashing in.
Senator, I support vaccines. I support the childhood schedule. I will do that. The only thing I want is good science, and that's it.
How about then say you won't make money off what you do as Secretary of HHS?
Before we go to Senator Tillis, I think it would be important for me to make it very clear that Mr. Kennedy has gone through the same Office of Government Ethics process as every single other nominee in the Finance Committee this year and in previous administrations. In addition to listing his assets, including the items that you've identified, he has signed an ethics letter that has been reviewed by the Office of Government Ethics concerning any possible conflict in light of its functions and the nominee's proposed duties. And we have a letter from the Office of Government Ethics that he hasn't complied completely with all applicable laws and regulations governing conflicts of interest.
Mr. Chairman, point of information here. Have we had a single nominee come through who's made $2.5 million off suing one of the entities that it would be regulating and plans to keep getting a take of every lawsuit in the future? Have we had that before?
I haven't reviewed the past documentation of every other nominee's financial interests. And so, no, but I know that every single time we get a nominee, their financial interests are attacked. That's why we have the Office of Government Ethics. That's why they've reviewed everything that's in his record. And that's why he has even, I think, and I don't know that I want to ask him to get into it, but he has listed his assets and has gone through a discussion of the responsibilities under our ethics laws and is complied with all of those requirements. Senator Tillis.
Thank you, Mr. Chairman. Mr. Kennedy, how's your morning going?
So far, so good.
Good. You came prepared. I'm glad that you did. I believe, addressed to my satisfaction a question about Title X and the president's priority with respect to Planned Parenthood. Can you just affirm that you are 100% behind the president's policy on Title X and the
Yeah, I'm
implementation of it?
100% behind it.
Thank you. You know, it's amazing to me that people, well, first off, you need to understand I was in a judiciary hearing this morning. It's very clear to me that some of these nominations are going to be shirts and skins. So no matter what you answer in the affirmative, they're going to ask you one more question so that you won't be able to answer in the affirmative. That's just the way the game gets played when we have nominees like yourself. So I think you're handling yourself well. I got a real quick question for you. Are you a conspiracy theorist?
That is a pejorative, Senator, that's applied to me, mainly to keep me from asking difficult questions of powerful interests. I was told that I was a conspiracy theorist. That label was applied to me because I said that the vaccines, the COVID vaccine, didn't prevent transmission and it wouldn't prevent infection, when the government was telling people, Americans, that it would. I was saying that because I was looking at the monkey studies in May of 2020. I was called a conspiracy. Now everybody admits it. I was called a conspiracy theorist because I said red dye caused cancer. And now FDA has acknowledged that and banned it. I was called a conspiracy theorist because I said fluoride lowered IQ. Last week, JAMA published a meta-review of 87 studies saying that there's a direct inverse correlation between IQ loss.
All right, so I'm going to assume
I could go on for about a week.
Is there any one of them that you can say, you got me? That really was a conspiracy theory, or are you in a
Not yet.
position to submit for the record? I think it'd just be helpful for every one of these narratives for you to submit that maybe for the record. You said something about SNAP lunch. I was in the State House in North Carolina before I came here, and anytime I'd go visit an elementary school, the first thing I would do is go to the trash cans in the cafeteria. And what we have now are kids that are not eating food because the dictates of the federal government have made it something that they don't want. But they say, well, it's a healthy alternative. It has processed materials in it, and it's not particularly attractive to them. So they throw it away. Trash cans full of food that these kids didn't eat. So then what do? They go eat snacks, or they go eat or they drink a sugar drink. The SNAP program, everything you've said about the SNAP program, I agree with. I think that we should be very, very strict about that. And it's going to make some people uncomfortable in the food manufacturing segment, produce healthy foods that we can put in the SNAP program. That's the way to address it. But we also need to look at the school health program. I was PTA president 22 years ago at my daughter's high school. And I feel like we've got these kids that need help. We've got to guide them through a process. Many of them are probably on Medicaid, and Medicaid's failing them. Everybody here says Medicaid is sacrosanct. Nobody's admitted that Medicaid is not producing positive health outcomes. Is that your problem in Medicaid right now? The program or the outcomes?
Is the outcomes. We're spending $900 billion and our people are getting sicker every single year.
Yeah, so anybody
President Trump wants people to have it, Americans to have high quality insurance.
Anybody who's building a case for the status quo of Medicaid is by extension saying that they're happy with the outcomes. I think it's unacceptable. I do have a question for you on Project Warp Speed. We supported the CARES Act. We had 97 people in the U.S. Senate vote for it. Everybody here, there was only one member of Congress that voted against it, I believe. And Project Warp Speed had CDC, FDA, NIH, and BARDA very much in the mix. Now, some people think that you're going to come in here and insert yourself into those agencies in a way that's never been done before. Let's say that they're a part of a future Project Warp Speed. Is it your intent to go in and do something that's never been done before based on my staff's research and insert yourself in a discussion that the scientists are dealing with in those different agencies?
No, Senator, what I want to do is, I'm not a scientist. I want to empower scientists. I want to make sure that science is unobstructed by vested or economic interests.
That's good.
Or by bad culture. And I'll just say about Operation Warp Speed, it was an extraordinary accomplishment, demonstration of leadership by President Trump. When he promoted Operation Warp Speed, he was looking at all of the different remedies, including vaccines,
Therapeutics, everything.
therapeutic, ivermectin, hydroxychloroquine, famotidine, even chlorine dioxide, and he was not looking at shutting down our country for the year, forcing people to wear masks for a year, forcing all social distancing that did not have any scientific basis, which Dr. Fauci has now acknowledged. He said, we took it out of thin air. But all of those changed during the Biden administration. And it became very narrowly focused. We ended up with the worst, the highest death count of any country in the world.
Mr. Chair, if I can just ask one final question, and I think it's a one-word answer. I've heard a lot of people complaining about healthcare delivery, Medicaid, on the other side of the dais here. Who's been responsible for healthcare policies over the last 4 years?
The Biden administration.
I mean, the president, the Biden, okay.
Yeah.
So that, I'd like to have heard more of those in oversight hearings over the last 4 years. I haven't, but I'm glad that there's an acknowledgement that you're inheriting a problem that needs to be fixed. Thank you.
Thank you, Senator.
Senator Sanders.
Thank you, Mr. Chairman. Mr. Kennedy, thanks for being with us. I very much like the slogan that you coined, Make America Healthy Again. And I strongly agree with that effort. Despite spending, as you indicated, 2 or 3 times as much capital on healthcare as other nations, we have 85 million people who are uninsured, underinsured. We have all kinds of chronic illnesses. Our life expectancy is lower than other countries. And for working class people in this country, they are living 6, 7 years shorter lives than the top 1%. We got a problem, okay? And I'm gonna suggest some ideas that I think can remedy that. Last year, the insurance industry in this country made over $70 billion, while at the same time, 85 million Americans are uninsured or underinsured. Do you agree with me that the United States should join every other major country on earth and guarantee health care to all people as a human right? Yes, no?
Senator, I can't give you a yes or no answer to that question.
Healthcare a human right. Is healthcare a human right?
In the way that free speech is a human right,
Yeah.
I would say it's different because with free speech doesn't cost anybody anything, but in healthcare, if you smoke cigarettes for 20 years and you get cancer, you are now taking from the pool.
Well,
and so are you guaranteed the same right? Or is there also a duty?
I'm sorry, I'd love to talk for an hour with you. We got a few minutes left here. All right. Every other country on earth says healthcare, whether you're poor or rich, young or old, is a human right. I'm not hearing you say that. All right, you've talked about the drug companies, and maybe we agree on this one. As you all know, despite the drug companies making over $100 billion in profits, paying CEOs outrageous compensation packages, we in some cases pay 10 times more for the same drug. Will you support legislation that I will introduce which says that in America we should not be paying a nickel more for prescription drugs than people around the rest of the world?
To equalize it?
Not to equalize it, that we should not be paying more than other countries for the same damn drug.
President Trump has asked me, in fact, I had a meeting with President Trump a week ago where we showed him the charts.
He knows the charts.
We're paying 10 times more from Europe.
That's right. And are you going to commit to us that you will end that absurdity?
I think in principle we can. We should end that disparity.
Good. Okay. That's great. All right. I happen to believe that climate change is real. It's an existential threat, and it is a healthcare issue. Donald Trump thinks that it is a hoax originating in China. Question is, in your judgment, is climate change a hoax or is it real, causing devastating problems?
President Trump and I, from the beginning, from our first meeting, agreed to disagree on that issue. I believe climate change is existential. My job is to make Americans healthy again.
All right, you believe that,
is
you
what
think
I'm-
that you disagree with Trump, you don't think climate change is a hoax, is what I'm hearing.
My job here is to
I'll
make
just ask you that,
Americans
Mr. Kennedy, not a trick question.
healthy. I answered your question, Senator
Okay,
Sanders.
you disagree with the president on that.
I answered your question.
Okay. I'm going to pick up on a point that Senator Hassan made. Look, there is no question that abortion is a divisive issue in this country. I would say a majority of the people are pro-choice. There's a strong minority who are pro-life. A year and a half ago, you went to New Hampshire, running for president, gave a speech, and you talked about government should not tell a woman what she can do with her own body. That's her choice. Now, I think everybody on that side is pro-life. I think everybody here is pro-choice. I have never seen any major politician flip on that issue quite as quickly as you did when Trump asked you to become HHS secretary. Tell me why you think people should have confidence in your consistency and in your word when you really made a major U-turn on an issue of that importance in such a short time.
Senator, I believe, and I've always believed, that every abortion is a tragedy.
But you told the people in New Hampshire that it was their right. All right, let me do a last question here because I'm running out of time. I think the gist of what you're trying to say today is you're really pro-vaccine, you want to ask questions. You have started a group called the Children's Health Defense. You're the originator. Right now, as I understand it, on their website, they are selling what's called onesies. These are little things, clothing for babies. One of them is titled Unvaxxed, Unafraid. Next one, and they're sold for $26 a piece, by the way. Next one is No Vax, No Problem. Now you're coming before this committee and you say you're pro-vaccine. Just want to ask some questions. And yet your organization is making money selling a child's product to parents for $26, which casts fundamental doubt on the usefulness of vaccines. Can you tell us now that you will, now that you are pro-vaccine, that you're going to have your organization take these products off the market?
Senator, I have no power over that organization. I'm not part of it. I resigned from the board.
Yeah, that was just a few months ago. You founded that. You certainly have power. You can make that call. Are you supportive of this?
I've had nothing to do with
Are you
leadership.
supportive of these onesies?
I'm supportive of vaccines.
Are you supportive of this clothing, which is militantly anti-vaccine?
I am supportive of vaccines. I will. I want good science and protect.
But you will not tell the organization you founded not to continue selling that product. Thank you, Mr. Chairman.
Senator Blackburn.
Thank you so much, Mr. Chairman, and thank you so much for being with us today. And I have no doubt that you will be confirmed and you are going to do such a solid job for the people of this country. And I do have several issues I wanted to talk with you about and didn't have time to cover them all when we met prior to the meeting, but rural health care is very important to me and the people of Tennessee. 78 of our 95 counties are rural counties. Now, over the last few years, we've seen hospital closures. So we have focused on access in rural areas. And my rural health agenda, which is bipartisan, focuses on innovation, telehealth, access points. It focuses on work shortages. And also, Senator Warner and I have together focused on making certain that we address the area wage index and do that fairly for our citizens that are in rural communities. So I would like a commitment from you that when confirmed, you and your CMS administrator will work with us to make certain that the area wage index is balanced and that it is fair to rural areas.
Senator, both Dr. Oz and myself recognize that rural health care is in crisis in this country, and that is catastrophic for our entire country. And I talked a little bit about my commitment to rural health earlier in this hearing. The regional price points, as you know, are set by Congress and not by HHS. I will certainly, and I know Dr. Oz will certainly work with you to make them sensible.
We look forward to that. Also, you and I, before you came forward as the secretary, the nominee, we had talked in years past about over-medicating youth and concerns over that. And I was looking at a report from TennCare, which is our Medicaid program in Tennessee. And I was concerned when I saw a number that TennCare had spent $90 million in 2024 alone on ADHD. This was 417,000 of our children. And $90 million. To me, that is heartbreaking, what is happening there. So how will you prioritize oversight of prescribing practices while promoting alternative solutions such as counseling, behavioral therapies, community-based interventions for our youth?
Exactly, and that's the solution. 15% of American youth are now on Adderall or some other ADHD medication. Even higher percentages are on SSRIs and benzos. We are not just over-medicating our children, we're over-medicating our entire population. Half the pharmaceutical drugs on earth are now sold here. 70% of the profits from pharmaceutical companies are from the United States, even though we only have 4.2% of the world's population. Not only that, but a recent study by Cochrane Collaboration founder Peter Ghosh found that pharmaceutical drugs are the third largest cause of death in our country after heart attacks and cancers. Oh, they're not making us healthier. We need community health initiatives. We need access to treatment. We need exercise. We need better food.
Okay, let me talk to you about one of those access points in treatment. And this highlights a problem in the federal Medicaid law. Since Medicaid's enactment, states have been prohibited from using Medicaid funds for care provided by institutions for mental disease. We refer to them as IMDs. These are psychiatric hospitals, residential treatment facilities with more than 16 beds. This is a discriminatory exclusion, and it denies payment for medically necessary care based on the illness that is being treated, and it has perpetuated unequal coverage in mental health care. So if you're confirmed, when you're confirmed, will you commit to working with me on repealing this discriminatory exclusion and ensuring equal access to mental health care for Medicaid beneficiaries?
Yes, Senator.
Thank you so much. I've got a question on PBM reform, one on artificial intelligence in healthcare. In the interest of time, I will yield back. I look forward to seeing you help make us healthy again.
Thank you, Senator.
Senator Lujan.
What? No, you're next. I'm next.
Excuse me, I made a mistake. It's Senator Cantwell.
Thank you so much. Thank you, Mr. Chairman, and congratulations on your nomination, Mr. Kennedy. And I've been absent only because I've been in another hearing with the nominee to be the Commerce Secretary. So I will review everything that you've said today and look at that diligently. But one of the things that I wanted to discuss with you is I represent a very big innovation state. And innovation in healthcare specifically, innovation like NIH funding to the Fred Hutch Cancer Center that helped develop the HPV vaccine, which has the potential to eliminate over 95% of cervical cancer. NIH also funds a lot of jobs and grants, nearly 11,000 people in the state of Washington and over $1.2 billion worth of grants. So while I agree with you on healthy foods, I definitely am troubled by the medical research side of innovation and some of the things that you have said. In fact, this issue about laying off 600 employees at NIH, or giving the fact that, to quote, give infectious disease a break for 8 years. So we've had a chance to talk about this a little bit, but the most striking example of this is when COVID hit. And we were the first in the nation. We had the first case, and it really was the fast response by the University of Washington that really helped save lives. So I just want to know that, are you aware of how harmful these issues could be for public health? That public health in and of itself could be affected by these kind of anti-science views?
Senator, I have always been a science person, a pro-science person. I believe in evidence-based medicine and gold standard science. When I said, and I've explained this before you came in, that 600 people out of a workforce of 91,000 is pretty typical. Last year alone, President Biden replaced 3,000 people at HHS and 700 at NIH. I want to say this. I said give infectious disease a break because that's been the principal preoccupation. Infectious disease, chronic disease is 92%, accounts for 92% of deaths in this country, and almost nothing is studied at NIH about the etiology of our chronic disease epidemic.
But right now,
money is going to infectious disease. And
I get your point. It's an interesting point. The problem is we had to respond, and it's actually the Gates Foundation and a flu cohort that figured out what was wrong, and that we had an outbreak of COVID that was going beyond the very first case. And so we had to build a very fast response. So I take this too. The University of Washington has conducted groundbreaking stem cell research on fetal tissue. To me, I know there's probably a lot of people that may not agree with this, but we're making regenerative heart tissue now at the University of Washington. So yes or no, do you commit to protecting stem cell research for scientific agencies if confirmed?
I will protect stem cell research. Stem cell research today can be done on umbilical cords, and you don't need fetal tissue.
You'll protect the laws that are on the books today and the research that's done.
My job is, Senator, to enforce the laws.
Okay, so I want to move to PBMs because PBMs are driving up drug prices. And one of the biggest things that we need to do here, I think, in a new administration is get a handle on everything that is driving up prices and lower them. The report found that PBMs generated $1.4 billion from spread pricing. That is where they are able to basically set the price, not reimburse pharmacies, and then pocket the rest. We've had bipartisan legislation in several different committees now to get at this. What do you think the solution is?
I think one of the really notable achievements of this panel was the PBM legislation that they put together in a bipartisan way. I haven't met a single senator, well, actually one only, but of the 60-odd senators that I talked to, all of them talked about PBMs and how important it was. And President Trump, during his first administration, pushed through a law to give transparency to PBMs. It got overruled during the Biden administration. Luckily, this panel is resuscitating that. President Trump is absolutely committed to fixing the PBMs.
My time is running out, so I just want to clarify. You believe that we should pass these laws that now have been proposed in the Senate?
I haven't read the entire law, so I don't know, but I think that we need to reform the PBMs. I think we need to get rid of all of these vested interests that are draining money from the system.
Okay, somebody suggested, though, that you thought you should convene the PBMs and talk to them about some sort of self-regulation. So I am trying to distinguish between these people who basically are doing illegal activities and ripping off, really, they're creating pharmacy deserts in my state. So I'm asking you whether you believe that we have to legislate in this area.
Again, I'm not being evasive. I just don't know exactly what the law says. I met with the PBMs. I met with pharma. My job is to meet with all the stakeholders. I've been meeting with stakeholders for 40 years. People I was suing, you want to hear from the other side.
Well, it's
That doesn't
okay.
mean I would let the PBMs write their own ticket.
I think
I support the efforts of this committee to come up with bipartisan legislation. President Trump wants to get the excess profits away from the PBMs and send it back to primary care, to patients in this country, to high quality health care.
I'll ask you for the record, since my time's expired, to look at the legislation that came out of the Commerce Committee that defines the legal activities that they are doing to drive up prices, and get us an answer for the record. Thank you, Mr. Chairman.
In principle, I support that legislation.
Thank you. And let me just tell you the list as we have to move forward to the ending here. Senator Lujan will be next, followed by Senator Marshall, Senator Warnock, Senator Smith, Senator Young, and Senator Welch.
And let me say again, Mr. Chairman, this is a matter of such importance. A number of my colleagues would like a second round, and I think it would be important to offer, say, a modest amount of additional time to get into this on both sides. I know I have some questions. I want my colleagues to have the opportunity to raise their concerns as well.
Well, I've said, as I have indicated to you, Senator Wyden, I'm not going to do a second round. I have been very generous with the senators. I think almost every single senator has had 7 minutes at least. And I will give you a second, as is our practice
I think
between the two of us.
I'll then divide my time up with my colleagues. I'll be
Okay,
even-
you are welcome to do that.
Thank you.
Senator Lujan.
Thank you, Mr. Chairman. Mr. Kennedy, when we met, you stated to me that it is not your goal to take away programs that work for Americans. Do you stand by that statement?
Yes, Senator.
Mr. Kennedy, do you know how many Americans rely on Medicaid?
It's about 72 million plus the 7 million kids who are on chips.
Appreciate that, 72 million. Yes or no, is it important that expectant mothers and newborns have access to health coverage? Is it important that expectant mothers and newborns have access to health coverage?
Absolutely, Senator.
Mr. Kennedy, do you know how many babies born in this country are covered through Medicaid?
I would guess, I don't know the answer. I would guess about 30 million.
I have it, Mr. Kennedy. About 41% or 1.4 million babies births are financed by Medicaid, according to the National Center for Health Statistics. Yes or no, do you believe that Medicaid is a critical program?
I believe that Medicaid is a critical program, but that it's not working as well as it ought to be. And President Trump has asked me to make it work better, that most Americans are not happy with it, that the premiums are too high, the deductibles are too high, and everybody's getting sicker. Too much money is going to the insurance industry.
I have a series of yes or no questions. They're pretty simple. Because you heard we're not going to get a second round of questions, I ask for your indulgence to be able to get through them yes or no. In New Mexico, as you know, Medicaid is often measured state by state. It might surprise you if you look at some of those surveys. In New Mexico, the response was 90% of New Mexicans on Medicaid report satisfaction getting care, 80% getting specialist care, 85% getting urgent care, 95% ease of filings out of focus. Not to pick on any one of my colleagues, but in Louisiana, 86% of people on Medicaid are satisfied with their interactions. 83% are satisfied getting care. 85% are satisfied getting specialized care. 82% getting urgent care. I can go on state by state, but we don't have the time today. Yes or no, do you support cutting Medicaid or reducing, and especially in an area where you and I spoke about with the federal investment in Medicaid, which is known as FMAP?
President Trump has not told me that he wants to cut Medicaid. He's told me to make it better.
Do you support cutting, yes or no? Let me ask you this way, since it's only about
I
President
support
Trump.
making it better, Senator.
If President Trump asks you to cut Medicaid, will you do it?
Well, it's not up to me to cut Medicaid. It would be up to Congress. Oh, and
You don't
I'm going
answer.
to work. I'm
Sir,
going to work.
Mr. Kennedy,
Senator.
Mr. Kennedy, you don't want to answer? I'll move on. Do you know how many states will end? Mr. Chairman, if I may pause my time. So I understand that people are getting asked to leave if they stand up with signs, but there's a lot of other as well, Mr. Chairman. So it needs to be extended to everyone. As Mr. Kennedy said, we respect each other when we have a difference of opinion. We're just trying to do our jobs here and trying to ask questions. That's all. And that's all I'm doing with Mr. Kennedy, folks. So I just
Senator
hope that we can.
Senator Lujan, you are right. And I ask the audience to please be respectful.
Thank you, Mr. Chairman. I appreciate that very much. Mr. Kennedy, do you know how many states will end their Medicaid expansion if the federal share of Medicaid drops?
Well, there's 40 states that have signed on to the expansion. So,
It's a smaller number. So it's 9 states would quickly have to end their expansion because of the laws that they have. That's about 4 million folks across the country. And in New Mexico, Iowa, and Idaho, they have triggers that it would immediately have to go into effect if in fact that gets cut. The reason I'm asking those questions is there's been a lot of chatter and conversations around Medicaid. Now, I agree we can always do better, and we must be doing better in America. But Medicaid has been shown to improve health outcomes, including mortality, quality of life, and access to preventative care as well. And there's some areas, Mr. Kennedy, that you and I touched on specific to Native American communities. One of the concerns that I have are these programs matter to folks. You shared your passion about caring for folks. I believed that passion. My question in this area is, as you know, when folks are doing research and they're going to check to see if medicine works on someone, if they're not included in that trial, it often doesn't help them. That's what all the evidence shows. So what are you going to do when programs are eliminated to require the inclusion of Native Americans in clinical trials when it comes to life-saving medicine?
I'm going to do everything I can to make sure there's Native Americans in clinical trials. As I said to you when I visited your office, I spent 20% of my career working on Native issues. My family's been deeply involved with them. My father and uncle were big critics of the Indian Health Service, the failure to deliver good health results or health care on the reservations. I'm going to bring a Native in for the first time in history into my central office, that all the major decisions in my office will be that he will have it. We've already interviewed candidate, a very, very good candidate, will have direct impact on all the major offices. One of my priorities is to improve.
I appreciate that. I have a follow-up in that space specifically. Will you commit to finalizing the congressionally mandated FDA guidance to increase clinical trial diversity?
Just repeat that again. I'm sorry.
Will you commit to finalizing the congressionally mandated FDA guidance to increasing clinical trial diversity?
Yes.
I appreciate that. Will you commit to reinstating all of the pages that were eliminated and people that were fired from this administration that have this responsibility?
I cannot commit to that because I don't know who they are.
Well, there's
I'll
some
commit
folks
to
out there doing the
working
work.
with you to make sure those positions are adequately staffed.
I will follow up in writing in those specific areas because I think there's some commonality here, but answers matter. And so I'd like to get those as timely as possible. The last thing, Mr. Chairman, that I'll say is one of the conversations I had last before this hearing was with a family that I've been working with to work with my Republican colleagues when it comes to autism and federal programs and making a difference in these families' lives and this little girl's life. What I'm asking now, Mr. Chairman, is unanimous consent to enter into the record an article from Autism Speaks titled, quote, "Do Vaccines Cause Autism?" End quote. And I'll note that first sentence states, quote, "Vaccines do not cause autism," end quote. Thank you. I yield back.
Without objection. And before we move on, we've had a request from several quarters for a quick
Autism
restroom
Speaks
break. We will
is an
take a
organization that
5-minute
is
recess. I'm
paid
sorry to
by
those
Big
remaining
Pharma.
5 or
So
6
that's
senators
why they
who
said
must wait a few
and
minutes,
that's
but we
the
will have a quick break. We will be back
that
as soon as we can.
parents have to deal with children with autism. All right, guys, I got so many thoughts on what we just watched right now. Well, first off, good morning, good afternoon, good evening, wherever you are in the world watching this. I thank everybody for sitting and witnessing this. It's going to be another hearing tomorrow. I'm going to stream that one as well. This particular matter in the world of the acting world of politics is the only thing that I really even care about. It's the only reason why I am into politics even a little bit, which I just want to confirm too. I am not into politics like that. I'm not a political person, but I find myself speaking on a lot of political topics and speaking to different political people only because of this matter here. Because regardless if I'm down here in Mexico, most of you who know my story know why. I'm not going to go into that right here. But I'm down here because I needed to find a way outside of America because my son was hurt. My son was hurt. I can't say what did it right now because this I really want people to share this, and people who think that politics don't affect you, they don't, because these people are going to do what they want to do. That is true. You're right in that. But health wise, like I got wrapped up in this. So regardless if I'm down here in Mexico out of that current system right now, I'm always in the system because of the tether that they connected to my family with the system. So I'm never going to not have to deal with it. And most of you too, because you have kids, they go to school, you may have someone in your life that is sick and is dealing with different kinds of cancers and different ailments, diabetes, blood clots, heart attacks, cardiovascular diseases. All of these things are pertaining to this one aspect of politics, and that is the people who are in charge of the people who are regulating our food, our medicines, all of these type of things. Because unless you're a Betharian, and if you are, email me because I really want to see how that really works. But you have to eat. Your family has to eat. You have to drink water. Your family has to drink water. All of this is connected. All of this is connected.
Everything you just watched, I need you to understand that everything you just watched on this press conference is all fake. And I don't know how to explain it to you. I'm just going to use the most simplest terms. And I'm not saying that I think it's fake. I'm saying that I know it's fake because I've been through all these institutions and I've got video of all of them. CHD, Kennedy's organization that he founded to protect us, the Childhood Protective.
The one that I think Bernie Sanders was just putting into
his
question.
organization,
Yeah.
CHD. I've spoken to them for more than 6 hours. Okay.
Mm-hmm.
So this is, if anyone is familiar with our story, you know that we found some patterns. We found some patterns, a 62 pattern, a 13 pattern. And by making us go through history to look at different events, you find these events reoccurring. And if you look back at what's going on in the 60s, you had the same thing that's going on in the 60s. If people are looking at the events, they'll see that the time, they're mirroring our timeline with the 60s. And in the 60s, you got the same thing that's going on right now. You got wars, you got conversations, and rumors of wars taking place. In the 60s, you had somebody who was a courageous hero, who was deciding to go against the powers that be to do wickedness around the world. And he was challenging these things in the 60s. And his name was John F. Kennedy. The notions that were challenged in the 60s by John F. Kennedy, the notion of the CIA is a wicked organization, the notions that Bobby Kennedy was speaking out in the 60s were for equal rights for people. He was a heavy civil rights advocate. These are the things that these characters, none of these people you watch in the real, all these people are fake.
Mm-hmm.
These characters came along to champion a cause that was a good cause, both of them. And then what took place was John F. Kennedy was assassinated by the CIA, the FBI, the American government. We know that. You know, this is something that's so common that people don't even debate it anymore. Mm-hmm. And Bobby Kennedy was championing a cause, and his cause was for equality. And they assassinated Bobby
Both
Kennedy.
of them.
They assassinated John F. Kennedy, and they assassinated Bobby Kennedy. And the person who assassinated Bobby Kennedy was a gentleman by the name of Sirhan. So they assassinated him. And Sirhan said that he assassinated Bobby Kennedy because of his support for Israel. So
what he said was his only connection to Bobby Kennedy was his relationship with Israel, because let it be known that Sirhan has been saying that he doesn't even remember shooting Bobby Kennedy.
Right, but I'm just speaking of the narrative.
Yeah. Mm-hmm.
The narrative that we were fed back in the 60s was that Sirhan
Mm-hmm.
killed Bobby Kennedy because Bobby Kennedy's support for
Israel.
Mm-hmm. Okay, so what I'm asking you to do is just fast forward it up to today. and look at the pattern and see what's taking place. You got this courageous individual who is under an administration that we're calling the Trump administration that is that's in control right now. Now, correct me if I'm wrong, but couldn't Trump just make an executive order to appoint him to that position? Now, this particular moment, I don't know the answer to that question, but does Trump have the ability to make an executive order to get him to make this man HHS secretary right now? Does he have the power to do that? Yes or no? I don't know the answer to that question.
And I know a portion of it because I just found out that executive orders and pardons, like, they still can be challenged.
Understood. But
yeah.
So if he can or not, I don't know the answer to that question. But I want you to see what's going on. And forgive me for how I look. What you're hearing here is real life.
Mm-hmm.
What's real is my 10-year-old just went into the other room and shit on himself.
Mm-hmm.
That's real. What you just watched is fake. And I'm telling you the script. And I'm showing you how they're going, what they're doing, exactly what they're doing to keep this bullshit going on. This is the script. You got Bobby Kennedy speaking here, and he's saying all these things, and he's taking up the gavel, he's taking up the cause to fight the poisoning of children during a time that we have to say vaccine with a W. We're saying vaccines and vaccines because vaccine, something that we're told we have to take.
We can't say it.
We can't even say the word vaccine because this is real. What you saw was fake. This is the trick. You got Bobby Kennedy here, who is championing, who's taking up a noble cause and looks.
I mean, literally the biggest. Listen, this happening is more important than Trump's inauguration.
100%. Listen.
Okay, because this is your food, this is your medicine, this is your water.
But it's fake. Let me tell you what they're doing. All of it's fake. What they're doing to us and what they're doing to you and your children is real. All of that is 100% real. What you just saw there was 100% fake, and they keep using the same scripts. Just like before, you have an existential threat that's doing harm to the American public. The same way we had in the 60s with your civil rights violations and your CIA X, Y, and Z. They asked Bobby Kennedy a question, and the question they asked him was, do you believe that healthcare is a human right or should be a human right?
Go ahead. You good.
Okay, I know.
No, you good.
And the answer was his question, was it yes? And the reason why the answer wasn't yes is because his allegiance to this place that we're calling Israel is all fake.
It's just like his dad.
It's all fake.
The stage sets
thing.
itself. It sets itself.
So here again, you got a place called America that's pretending that it is a righteous, beautiful place in a land for the free. It's pretending it's all a script. And then whenever you have courageous people who are standing up against the terrible evils that are taking place, they all get killed the same way. And
he's a Kennedy. And everybody knows that Kennedy's a fair game. It's like everybody's kind of willingly accepted the fact that he's going to get assassinated because his uncle was assassinated, his father was assassinated, and they were both speaking on the biggest issues in the world. Like, these are the spokespeople that we get.
Right. And all of this is fake.
Mm-hmm.
Because these champions that they champion these causes that they champion, they're supposed to be fighting for us, and they are fighting for us, and we get to, that appears as if finally there's somebody fighting for us, real people with real experiences. And that's great, and he gets all the praise for that, and we're going to give this man praise for that. But what he's really aligned to, which is the bigger threat, is that he doesn't think that healthcare is a human right. Now, I want you to understand that to say that you don't think that healthcare is a human right, just listen to what that means. That means that if I deem you different than me or less than me, that I don't necessarily think that you should have this human right than me. So the reason why he gave that answer, which is the simplest answer in the world, is because this is his way of letting the highest of his priorities, the people who are his real masters.
Israel.
It's the it's right.
Well, Israel.
Israel ain't even real.
It's not real, but it's the
of course, but it's just a
that
place.
deity or whatever.
But it's just a place. It's just a place to put some words on it. This is a place to put some words on it, because everything that an Israeli is doing to the people of Israel right now, those leaders can leave out of the country and go to Lebanon.
And the people will be right there.
But my point is, they could run their government from another country.
They do.
And everything still take place there. So these are just places that we're putting names on. What I'm saying is this. I'm going to give you the answer to all this shit, and I don't know how to do it personally yet. I'm working on it. Bobby Kennedy just did his sacrificial thing to get him into the club, these clubs you keep hearing about, but the club that allows his name to be remembered throughout history, because that's all it's about in this physical place. So what he is saying is, I don't want people to poison babies, and they have 62 babies, and they have 62 old people, and they got 62 North Koreans. And everyone who's following me knows what 62 means. He's saying that I am aligned to a higher God, a higher power, a higher frequency. I am willing to fight and be the hero to make sure that you don't 62 innocent babies. But I am not willing to state that health rights is a human right, because I am making a commitment to keep this thing going. This whole thing, because by not saying that, and him being put in the position, he's saying that it's okay to save babies here in America from these things called vaccines. And listen, I can't even say what damaged my child. That's real.
That's real. And
that's real. I can't even say the word of what damaged my child, and y'all not questioning why a person can't say what happened to their child.
And then, for all of you who don't know, Bobby Kennedy was hurt by a vaccine. That's why his voice sounds like that. His voice. They tried to take away. They've already been chipping
the
away
story
at
writes itself, thing, because he was a hero. That even when they took away his voice, he spoke out for it.
Exactly, and you heard her saying to him, they want to make sure that he can't sue, and he couldn't even say, "Hey, I'm a victim of some vaccine. I'm a victim of it." So he couldn't even say it.
These people are making allegiances that they're showing you that they have a higher allegiance to another power, another interest, because they can stand up to these things. Vaccines, yo, I can't say what the word is. I gotta say vaccine, because if I say the word and pronounce it with a V, They delete my channel for just saying the word. If that doesn't strike any American as buffoonery, and nonetheless, RFK just made a promise, and he just said that he wants to stop poisoning here. But because he supports this side politically, he's saying that if they become his enemy, that it's okay for them to die needlessly. So he's showing you that you're not the highest priority of what he's there for. You know, it's like, what are you protecting? You know, if you have to run outside your house and because your house is on fire, you grabbing something and you got 10 seconds, what are you grabbing? You're grabbing your children. And if you have time, you'll grab a picture if you have time. But you're grabbing your children. So what he just said is, if the house is on fire and we only have time to grab one thing, if he's saying that he's going to grab it's okay for people to make other people and prevent other people from getting health care if I don't agree with them. That was his first priority. You understand? He's saying that his second priority is, I don't want children in America to be 62 by vaccines. That's the second priority. You understand? That was first. That was what he saved first. Let the people know. And all of this is just a show. What's happening to us is real. What's happened to us is real. This thing is just designed to keep the cycle of violence perpetuating. That's all it is about. Because he is not going to stop the violence that's going on in Palestine. It's called a genocide. And because he's pro this word called Israel, because he's pro-Israel, he will not make a commitment to saying that all healthcare should be a human right, because it's his way of saying that because I support this thing that we're calling Israel, it's okay for the children in Palestine to be murdered. That's why he couldn't give you an answer on that, because he's letting this system that runs things know that I am committed to keeping this thing going and keeping the conflicts. Because as long as there's a conflict taking place, we are confused and we are made to be in fear. But fast forward everything. All of this is a test to see if humanity has learned how to forgive. It's fucked up. It is a shitty test. And I am trying, and y'all can look at me today and see I'm not doing too good. This whole thing, this test this time around is about forgiveness. And the reason why things can't move forward is because we keep having people who are pretending to champion our fight for us, champion a cause, and be a king in one aspect, but then be the devil in another aspect. And with that, it keeps this thing going. And the reason why this thing has been able to continue is because we haven't learned how to forgive. Listen, I'm telling you, I'm trying. I'm trying because I know that's the answer. all of this is taking place. We mad at black people, angry white people because of slavery, and we have a system that wants to remind us of slavery every day, and we can't forgive it. And it's designed for us to not have the ability to forgive it because we get treated like purity shit in a country that we were here first and we're native to. And even if we weren't and don't believe that, we were brought in chains and enslaved, and our mothers and our grandmothers and sisters were raped by barbarians. And then their sons and grandchildren get to be barbarians to us. Well, we're not supposed to forgive that. We're not supposed to forgive that. But because that's real. But
I think amends at least should be done.
Well, see, that's the other part. I can promise you that as long as, what I'm saying is the system designs it so we can't forgive it.
Yeah.
They designed it where you can't forgive it.
Yeah.
And the highest elevation of man is to be above it and understand what's taking place and know that we have to forgive it in order for our own spiritual development. And it sounds, I'm telling you this, and I am struggling with this because what's happening with us, despite what you just saw, in reverse of what you just saw on TV, is us all fake, but this is what's happening. So it's hard to forgive when I know that there's a purposeful effort to 62 people. And it has not been addressed. And it's continuing to go on.
62 is not a number, okay? 62 is the way we say KILL.
Right,
because you can't say KILL. You can't say that on here. So when we say 62, that's what we're saying.
So they get to 62. What they're doing to us is real. These people are all phony. They're all fake. They're not real.
But they are our representation.
But we're letting them represent us.
They're in.
And this thing they got to keep going. This thing that they got to keep us going. It has to stay. They have to keep us fighting so we don't have forgiveness. We have to, we got to forgive these people.
Yeah, we do. And I'm going to tell you, and this whole thing is a ploy because listen, I do not support the whole, I believe in the existence of Israel. I believe in the existence of any human that God brought here. Now, I have a different kind of feeling about pedophiles, but that's not what we're talking about right here.
You gotta forgive them.
If the Creator let them come down here, so be it, but if you cross my path and you try to violate the experience that the Creator gave me, then that's when I get involved with that. But in regards to the genocide that's been taking place, that everyone is fully aware of, the illegal occupation that's been taking place, that everyone's been made aware of, I am totally against that. So I don't want, so there's always a narrative, like if you support RFK, well, he supports Israel. And it's like, well, look, I can't help that we're never going to get a real person in these representations. That I can't do anything. You can't vote for it. You can't do nothing. We all know that's all staged. That's all pre-planned. It's all rigged. We know that. But what I'm trying to say is when you're watching literally the whole government, the government's representation of being the people who have to do the checks and balances to make sure that these appointments are in line with the Americans, the civilians' life, because we're talking about our lives. These people control what we eat, what we breathe. Okay, so I'm saying that we cannot get distracted. But I think that we also need to be vocal. Like, people need to say, hey, RFK, you're a hypocrite because you're talking about human rights, and you're talking about, people need to know what they're getting, and these are children, and you're so sad, you're so upset about children, but that Israel is literally killing millions of children, since October 7th. And they've been occupying these people's land for forever.
And please don't forget, there's 3 genocides currently taking place in Africa right now.
Yes.
So
yes.
they're going on currently. And I'll do another space about that, just because I want to just kind of, we are in a system that people who are making decisions have decided that they want this chaos that we're all living in. And for them to remain in power and to do all the different atrocities around the world so they could live better lives and get a kick out of, they need us constantly distracted. They need us constantly distracted, and they need us constantly fighting each other. And they make things impossible to resolve, and they don't stop. Because in order to ascend, you have to forgive. And y'all see, I'm still here with you. So I'm trying. But if there's anything, the hardest thing in the world, especially for Americans, there's no people in the world that's more unforgiving than Americans.
Mm-hmm.
We live in a culture of America where people don't even say sorry.
Mm-hmm.
And we live in the culture of America.
We live in a culture where they say you better not say nothing.
But
you better not even say nothing that happened to you.
But you're told that you look weak for saying sorry.
Oh yeah.
We have a culture that if a politician says something incorrect, that because he apologized or she apologized for it, she's made to look weak for saying sorry. So we're definitely the least unforgiving nation. But what I'm trying to say is, I'm not trying to kumbaya none of y'all and trying to religious y'all or nothing y'all. I'm trying to tell you the whole trick behind the whole thing. The whole trick behind all of it is we don't know how to forgive. Don't just get out of biblical, get out of kumbaya. I'm saying
it keeps going. It keeps going.
The trick, good or bad, I'm saying that the trick behind all of this is they don't know how to forgive. And because they do such despicable things, because such despicable things are taking place right now, because such despicable things have happened to you and your loved ones, because such despicable things are taking place around every government in the world, and it's ongoing. We can't forgive them for it.
Right, because you can't forget. Yeah, and that's what they're saying, because you can't forget. And see, the thing about it is, it's like, because you can try to forgive, but they never correct things so you could forget. So you could just be like, man, wasn't that a crazy time when that was going on? You know what I mean? Like, we're in the future and we're just like so ashamed and like so like remorseful for ever participating in anything that could ever build up to just one individual's life, just, getting the domino effect of the repercussions for these terrible ways of life, these customs, these policies, these laws, these whatever you want to call it, these lines that they defined us in that we had to walk.
It's fake. And it's fake. All of it is fake. They know, and it's all fake. Here's a perfect example. I'm offended that there's not enough people discussing that every person who was held in high esteem with melanists who are melanated are all being dragged into the worst crimes that you can do imaginable. Now, it's designed to do that. Because if you are a black man, what they're calling us, my complexion is copper. If you are, then you are noticing, man, every person who we held in high esteem, they're showing us that these people are worthless, and the worst of worse, they kill babies. This is what they tell us now. So that upsets me. That upsets me. So because of that, I can't forgive it. Because it's happening right now, and this is their movement. But what I'm saying is it's designed, they do all these things as triggers, and it's just designed to keep us in this state of revenge.
Mm-hmm.
We want revenge. Humanity wants revenge. We want the other person to get what they deserve.
Yep.
We want revenge more than anything else.
Mm-hmm.
Because we don't want to just peace to take place when my next door neighbor murdered my entire family.
Hypothetically.
I use extremes because I just need to make sure that people understand the difference. We want for that person who did that to suffer and pay for what they did to us. We want revenge. I want revenge. I've carried out revenge. I've humiliated a lot of people who I deem as wicked. But because I deem them as wicked, does that give me the right to humiliate them for what they did? I did it. If I'm honest, I'm not sorry. Because even though I'm supposed to be above it, because they hurt me and hurt my child, I can't feel guilty over the people who I have humiliated. And that's the trick. It's been designed to do it. That's everything. The same setup when they decide if Bobby Kennedy gets confirmed, somebody's going to kill him and say because he was for Israel and Palestine. That's what he's going. He's for Israeli state. And then people are going to fight and say that this was a conspiracy of the government. And
it was.
We know the government. And somehow, Democrats don't trust the government and Republicans don't trust the government, but they fight each other.
No, listen. And they don't like the agencies. They don't like the agencies that work for the government, but they hired them because we didn't hire them. We didn't vote for these agencies that they keep blaming everything on, the CIA, the FBI, FDA, all of these agencies. All of these are agencies that the government created.
We have to.
So we had no vote. We had no say. We had nothing. Like this is their terrible hires that they don't even like, but they act like somehow that the things that they created are more powerful than them.
But these are the devil's children that we're watching. And the pledge they made above everything else is, we just ain't going to fix this. You understand?
They aired out everything on that hearing. They aired out everything. And both sides did it. They made sure so, because like the opposing side, they get to say everything that's real that Bobby Kennedy represents, but the way that they're delivering it is because they're saying that it's ridiculous. But they get to get the message out there so you hear all the truth of what's going on. All of the truth, because everything came out.
It's a trick. And just all I'm saying is, if you looked at that hearing, you can see that it's like, is it okay to kill babies? No. Is it okay to kill your wife? Maybe. So what I'm saying is that these characters that they're creating is all fake. None of this is real. But no, I don't know if anyone's paying attention that things are getting progressively worse. And in these days, they're speeding up. But if we go to 911, and what took place September the 11th, we'll see that things were a particular way, way better than they are now, so to speak. But after that took place, because we were hurt, we wanted revenge. And because we allowed our government media to convince us that the actions of 19 men was important enough to go to war with two countries, they let the actions of 19 men convince us that they represent the entirety of a community known as Islam.
Mm-hmm.
You understand? They let 330 million of us believe and accept that these 19 men who did this terrible act represent the beliefs and the actions of over 1 billion people, over 2 billion Muslims. So we allowed our system, what we're calling the government, to take action and go to war and kill millions of people. We allowed our government to go to war in a country that they said had
weapons of mass destruction
and killed over 1 million civilians in Iraq.
And they never found the weapons, and we've known they haven't found the weapons since when? Since
2002.
Yeah, 2000.
So yeah, we knew. Like
No, because we didn't go to war until 2003.
I'm sorry, 2000. I'm sorry, 2000. And we went to September 23rd, 2003.
Right.
So I'm okay. Here's why my head is messed up.
What I'm saying is, we knew that there were no weapons before Obama got in office.
But what I'm saying is, they knew that there were no weapons in 2004.
Right. Exactly. Right.
And
there you go.
In 2004, and still elected a president by the name of George Bush.
Yep.
So what I'm saying is this.
And we're still in Iraq.
Right today. Still there.
Like, we're still there.
Still there.
And we left, we right, and just pulled abruptly everybody out of Afghanistan.
And what do you know?
But left all of the military equipment, tanks, missiles,
and
guns.
And Biden abruptly pulled them out. But remember, 8 months prior, Trump went to Afghanistan and told them that in 8 months we're pulling everything out. So the people in power who were out of power in Afghanistan, like if you look at what happened to Afghanistan, and just let me do this in a way that Americans, you're not offended. If we just watch what happened with Afghanistan went into war. The U.S. military went to Afghanistan for the so-called hunt for bin Laden, and it destroyed their country and crippled their economy, just completely demolished them. Then they occupied the country in Afghanistan for like 22 years.
Mm-hmm.
How long they occupied the country. Then, prior to them leaving the country, Trump told the Afghans that, hey, the Taliban, as a matter of fact, Trump told the Taliban that, hey, we're going to be pulling out here in 8 months. Then Joe Biden comes in and then abruptly pulls them out.
Yep.
And The people who were helping out the Americans were jumping on planes and running and holding on to tires, trying to get out of the country because they knew that when the Americans pulled out of Afghanistan, that the Taliban members who they had been fighting against were going to kill them because they sided with the Americans.
They had no protection.
You understand? Because they knew that because they did that. And you know who else knew that? The American government knew that.
They left the weapons.
The American government
They
knew
left
that.
the weapons.
They knew that the people who helped them were going to suffer once they left, and they were going to get vengeance because they needed to keep up the cycle. They need to keep up the cycle, and they need this thing to continue on. So there is no forgiveness.
Nope.
Now listen, I'm not there because if I was there, I wouldn't have to be here with y'all. But I don't know how to do that. But they make it impossible. But I also know that if a person isn't willing to give you the gift of forgiveness, you have to give it to yourself just to be able to no longer be connected to that frequency. And that's what my struggle is, being able to truly forgive in my heart so I can ascend. But if you're paying attention to everything that's taking place and this thing that we're calling history, it's all predicated on revenge. Every action, every cause, every effect is always revenge. And it's like, man, just look at every action. If you think of every part of history, think about the Israelites sacrifice Jesus. Well, we gotta hate the people who killed Jesus. You know, everything is predicated on revenge, and it's designed to make us not forgive. And if you believe that this is real, that's what I'm saying is this is a simulation. We're living in a simulation. Where we truly are, I don't know where we truly are. But this is just a physical embodiment. We're living in a hologram where we're able to sense in the 3D. And none of this is real. We feel like it's real because our mind is telling us real, but we're able to be mind controlled. We know that. Our mind is telling us it's real, but none of this is real.
Yeah, I definitely believe that we're all MK Ultra.
But I mean that every sensation that we have in the mind is electrical impulse. When you touch something, there's a neurotransmitter that tells your brain to feel it. The same way, if a person loses feeling in their legs, there's a neurotransmitter from their brain that's not communicating to their leg, that's telling them to not feel it. So every sense is a brain interpretation that's make us to recognize these things, which tells us that we're not really here, we're somewhere else. But we've been able to we've been able to do everything except forgive. And that's the whole thing.
Because they make it impossible to.
Right. They make it impossible.
So
but because they make it impossible, we have to stop giving it power. And because they make it impossible doesn't mean that we don't stop them from what they're doing. But what was done to you and me and all of us,
the whole world, it was done to.
For us to do that back to the person that did it keeps a cycle.
Yep.
Listen, I took my son to his pediatrician, who's been treating the family for more than 40 years. My son got a vaccine. You understand? Because I'm not allowed to say the other word. My son got a vaccine.
Or even say what happened immediately after they got a
the
vaccine.
same day. The same day. You understand?
But we're supposed to just act like that didn't happen.
Right. So what happened there?
Stop it.
I have to. Y'all hear that lovely noise in the background? That's real life of what this looks like. Not some guy who's in a $1,000 suit who is the royalty. Y'all understand the characters? The Kennedys are. You don't think you don't have a king and queen of the system here, but the Kennedys are America's royalties.
Mm-hmm.
Of course, they'd be the knight in shining armor to save all the buffoonery.
They always are.
So, what I'm saying is, all this is fake. Mm-hmm. This message that I'm giving right now, unfortunately, is, dare I say, I'm hopeful for it because we're living in a system where the people who serve other gods that want to keep this thing going, who idolize these other gods and really work for these other systems, gods, with these principalities, are hell bent on keeping this thing going. I think everyone should part their ways and start over wherever you are and stop giving powers to the system. The system is completely wicked.
Yep, and see, this is real.
We have been able to overcome everything, humanity. And if you're copper colored, this recent history, no one's been through what a copper colored person has been through. But then you study and you realize, wow, no one's been through what the Palestinians have been through. Then it's like, man, you look at Mao Zedong in China, he starved 30 million people. Who's been through that? Who's been through? So this particular time, the focus is on what happened to Black African slaves and what happens to the Jews during the Holocaust. This is what we give our energy to. But you know that there's three genocides taking place in Africa right now that we're not even speaking of. We give our attention to these people and all this is fake. And when we give our attention to these people who all are working together and the liars, it gives them the strength, the energy, because everything is all energy. We know that. It pulls away from your energy and it gives the energy to them to do terrible things. We've been able to overcome everything, but the reason why things take place is because we're not willing to let go of what was done to us. And as a copper-colored, melanated man from Baltimore, I was born in Miami. We have to forgive everything that was done to us and will continue to be done to us. And we have to make some hard decisions. If you think this thing is going, everything is going great, and you think that the people who are in power now are not the same people who was in power a month ago, if you think any of these things are real and they're going to change anything in your life for the better, then God bless you. But if you're honest with yourself and you just look objectively at this, why are we arguing about whether health is a human right? You understand that for white America, you folks who call yourself MAGA, you understand that they played the same thing they do to us to do to you. Let me show you how y'all got tricked and bamboozled and swindled for you folks who call yourself MAGA in white America. Y'all think that this guy by the name of Donald Trump is going to come in and save the day. And it's like, man, can y'all just play chess for a minute? You understand that all of us, independent, Democrat, Libertarian, Republican, all went through COVID. All of us were affected dramatically, some more than others. Some lost lives, some are still sick.
Yeah,
And
I lost my brother.
I lost my uncle. I lost a couple.
Yeah, we lost a couple uncles, but the one that hit home for me, everybody has like one that like really hit home, and it was my brother. Like my 40, well, he would have been 44, but he was 43. My 43-year-old brother.
So understand that for you folks who are MAGA, you had a government in place under this Biden administration. Let's take it back to 2019. You have a disease called COVID-19, okay? And because of that, everybody was going to die. And a guy by the name of Bill Gates said that everybody in the world, the whole world, in order for the world to exist and for all of us not to die, the entire world has to take a vaccine. The policy of our HHS Secretary under Biden, Anthony Fauci, Bill Gates, the WHO, the CDC, the UN, the people that we put in charge of our lives, all told everybody in the world that if you do not get this vaccine, we're going to all 62. The whole world is going to 62 if we don't get this vaccine. And this was done at a warp speed under Donald J. Trump when he was president. So then you get Joe Biden, who comes in as president and says, you have to take this vaccine. You have to take it. And everyone got mad and they shut the world down. But then Bill Gates and Anthony Fauci then say, we never said it was mandated. We didn't say it was mandatory. Go and pull it up yourself. Anthony Fauci said that if you take this vaccine, you will not get the disease, you will not transmit the disease, and you're going to protect everyone around you. Now, everyone who got the vaccine still got the disease. So understand that who's lying? Well, it's clear that Fauci lied, but they want you to look at Joe Biden and say Joe Biden enacted these draconian policies. But then they get to keep you in the fight and act like Trump didn't make the damn vaccines. They're working together. It's just to keep the fight. And let me just say it, and I hate even getting into the whole black and white thing. White folks, start looking at yourself in the fucking mirror. Because y'all get triggered off the same shit every time, and it's annoying being anything other than white, because y'all triggers are the same fucking triggers that they still use. So you got Joe Biden that told everybody in the world you can come here now, to the tunes of $400 billion. Mm-hmm. And then you got Donald Trump on day one saying, okay, now we got to get rid of these people who are raping and murdering and stealing our jobs. They got to go home right now, to the term of $488 billion. Would you be better served if he took that $488 billion to maybe, I don't know, help you, help your community, help your school, help the farming industry, help you people. Honestly, white people, would you prefer for Donald Trump to spend $488 billion getting rid of 11 million people? Or would you prefer Donald Trump to take 488 billion people
And divide it
and
up between
divide it
the
up
American
amongst the American
population?
population and fix the community? Which one would you prefer? Now, for you who are saying, I prefer for him to get rid of the immigrants, that's because of revenge. Because you're worried about what's going to happen to you if you let them come in your country. That's revenge. So stop falling for this. You don't see that one administration. The reason why they let Joe Biden in because the whole thing was fake. They cheated, and Donald Trump did win in 2020. But because they want to enact these policies, they have to give both parties hands and keep their hands always in the pot of filth. So we always got something to argue with, and all of it is fake. It's all fake. So I'm saying this to say that we know how to do everything except forgive. That's all I'm saying. We know how to do everything, and even harder, how to forgive without receiving an apology. Because if you look at what's going on right now, you saw this in a movie back in the 80s. If anybody saw that movie, Revenge of the Nerds, if you saw Revenge of the Nerds, they told you what they were going to do. They had a whole bunch of jocks and football players bully a bunch of guys who were nerds. And once the nerds got together, they created a plan where they could degrade and take away everything that the barbarians took. You understand that the nerds wanted to emasculate the tough football guys, and they wanted to make black men gay. This was the nerds. This is the whole agenda. Like the nerds is telling you, when these guys we call nerds get in control, because they were ignored and felt emasculated. When they become older, these nerds are going to all get together, and we're going to emasculate you guys from the football team who flushed our hair down the toilet and just being a black guy, because all black people were just born naturally cool. We're going to make y'all black, in particular black men. We're going to do our best to make all y'all gay because of how we felt. So it all starts with revenge, and the revenge started with our childhood. It's trauma. That kid who got bullied and got his lunch money stolen was traumatized, and that child was never healed. And he became Bill Gates. That child who was called a faggot, who was called ugly, had trauma that wasn't healed. So now he's become Anthony Fauci. So the people that we despise the most, who we hate the most and the absolute most, were traumatized by a system. And the system is us. We are the system. We did that to them. We did that to them by watching and allowing things to take place that we knew were wrong, but still went along with it, or just sat silent. When we was in kid, we take it back to the 5th grade when you saw bullying take place. Well, you did one or two things. You laughed, went along with it, or you watched. The worst thing we ever did was send our children to school.
Mm-hmm.
That's the worst thing that's ever done to all of America. We sent our children to school. But that girl who has her period during cheerleading sessions during a big game, that's traumatizing. And that is something that, if not properly addressed, that girl is traumatized. And the trauma involved with that because it didn't happen to you, you can't understand that. So you don't know how that affects that young girl. And the feeling and the self-doubt and the low way of feeling she's feeling about herself, the fear of embarrassment. Now, she feels that way because we've even weaponized periods. We so fucked up that we weaponize periods. Every woman in the world has one, had one, or is going to have one at some point in their life. That's just nature. God made it, Creator made it that, okay, this is the time that I decided she's ready to have the ability to bear children physically. So it's going to start now. But this girl has to feel shame and embarrassment and humiliation for Lord knows how long, because she had a period doing a cheerleading thing in front, whatever. When periods are had by every woman in the world, but we weaponized to make shame for something that is natural. So if they have the ability to weaponize something as natural as a period, imagine what they can do to us. Women have to, when they're on a period, women have to hide the fact that they're on a period. Why is it now embarrassing or uncomfortable? Women have to hide when they're having a period. That's the same as a person having to hide to take a poop. This is something that is part of this simulation. But they weaponized a period where women have to hide a period. So a woman has to hide her period because she has emotions, she has hormones that fluctuate, because you lose blood, things gonna happen to you. And these are beautiful things. So she may act differently. And they get that to use that as an excuse to say the period is bad. We weaponize the period. This isn't the discussion I was trying to take. What I'm saying is that we weaponize a menstrual cycle. We weaponize the menstrual cycle.
Yeah, anything can be normalized. Anything can be normalized.
But, okay, now I remember what I'm saying.
Yeah.
What I'm saying is that trauma that we dealt with as children never stopped.
No.
Because what was traumatized to us or traumatized to have to witness it never stopped. Ariel seen some of the worst trauma you can imagine in terms of violence. She went to a school in middle school that didn't have teachers.
Shout out to Lamel.
It's in Baltimore.
Baltimore City.
They didn't have teachers. So she's seen 11-year-old, 12-year-old boys beat each other almost to death.
Mm-hmm.
She's seen children beat other children with pipes and crack children's skulls.
Mm-hmm.
Now, it didn't happen to her, but she had to witness that, and it traumatized her. But because it didn't happen to her, we get to pretend that didn't happen. So what I'm saying is, we are either witnessing trauma or we're being traumatized, and they're not letting it stop. Matter of fact, they're speeding it up.
Mm-hmm.
And these traumas have never been addressed. And when these people turn into your law enforcement, the police officers
who got teased, who used to come to school smell like pee. You know, I mean, just think about the whole dynamic of your experience in school. You always had a kid that smelled. You had a kid that couldn't get no clothes. You know, like they didn't have the cool stuff. You got people who literally got
People
learning
with-
disabilities.
People being poor.
Yeah.
And for me, my disability, I was teased because I was copper colored in a white school.
There you go, race.
So
so you have so many layers that they put inside of this ill-prepared environment that is not it's not a controlled environment,
it's controlled.
No, I'm
It's
talking
controlled
about I'm
to-
talking about emotionally. It is not emotionally supportively controlled at all. They may have guidance counselors and all that kind of stuff, but the things that transpire in schools are things that literally almost mold a person
That's the
what
whole
they're
point.
going to be. And it's not about, what you want to be in 5 years, whatever bullshit you write down on a piece of paper. It's like, no, it's
We're
when
traumatized.
I went to the bathroom and then somebody came in, pulled my pants down, and people saw me in my underwear. Like that's certain. That didn't happen to me, but that's happened to tons of kids in school.
It's the worst thing any of us ever could have done is send our children to school.
Yeah.
Because you're going to an environment where they tell you that you need to know how to do this. And if you don't know how to do this and do everything the same way,
you don't make the cut.
You don't not accepted.
You don't
So
make the cut.
they're telling every single one of us that you have to be, you don't have a choice. You have to be this one thing, even if you are not this one thing. And I'm not talking about gender and all that stuff. If a person is 7 years old, but he has the intellect of a 19-year-old Harvard student, you make that child who's 7 years old stay in the classroom for 13 more years, whatever the number is. You make them stay in that classroom throughout these years when that person's smart. They're trying to make robots out of us, literally. And when they do this to us as children, and all of us have done it, and I mean, all of us have either been traumatized or witnessed a trauma, which is also traumatizing. Sometimes the trauma that people have to watch trauma is worse than the trauma that actually was inflicted. There was a murder attempt on me in Africa on Brussels Airlines, and Ariel and her mother were more traumatized than me, even though they broke my ribs. So they got traumatized, and they're still traumatized because of that. When we were kids, all of us, 100% of us, were either traumatized or witnessed trauma. Not to mention all the children who have been sexually assaulted, who are traumatized, and all the little boys who've been sexually assaulted, who are traumatized, but are too afraid to say because it makes them gay, because we're living in a society that a little boy is more fearful of shame than be assaulted. A little boy in a society is more embarrassed of being raped. He'd rather walk around with the shame and pain of being raped because there's a society out there that's going to dismiss him or call him a faggot or do both. I just want you to understand where we live. And because we're all going along with it, and we're all going along with it, we don't see the end result of what going along with it does. We made Fauci. Tupac said, I wasn't given this world, I didn't make it. But we made Fauci. We made Bill Gates because we sent them to school, and because they had no athletic ability, smelt funny, unattractive, wasn't cool and awkward. We made them feel terrible. The kids who had the thick glasses, the braces. If anybody's honest about being a child and going to school, the worst trauma most have had is an embarrassment that took place in school. And you got people who still call people. I know niggas who still call this dude named Kevin Stinky Kevin, and they're in their 50s. He's Stinky Kevin, nigga who smelled in high school. That was 30 years ago, and they still call the nigga Stinky Kevin. That's traumatizing. That's traumatizing, and that makes a person have to act in a particular way. It makes people feel bad. It makes them feel bad. I want to publicly apologize to Benjamin Crump. Anybody who knows me, I've made exposés and videos about Benjamin Crump because Benjamin Crump is a character who they placed in front of a movement to do despicable things. And I used to call Benjamin Crump gorillas, monkeys, and orangutans. And I even made
you
a
lost
video.
our YouTube channel over there.
Yeah, I even made a video with pictures of Benjamin Crump posed with gorillas.
I can show it to you if you want.
So, but check me out. Benjamin Crump is in front of horrible, horrible things, and he's part of a system that's whole goal is to keep Black people in a horrible frequency and for us to be angry and always hurt. He is the representative of this organization, and where his job is to remind Black people, hey, look what's happening to you. See what they're doing to you. See what you're doing to you. See what they're doing to you. See what they're doing to you. How do you know he's a fraud? You know he's a fraud because he takes 3 or 4 cases, but you look at your community and you see all these things happening every day, all day in every Black community that's impoverished. But he makes certain ones his baby. Well, all of these things are happening
And
in
most
all
of
of
them
our
are
cities.
dead. He doesn't do anything about what's happening to prevent anything from happening because he could be putting all them little efforts and speeches. He could be putting court proceedings. He could be actually getting things done and accomplished.
But
what he does is all he does is get money for people who die.
But he's part of a system where his job is
to make it look like
pain.
things are being addressed.
Right.
That's it. It's just to pretend.
So that's why I talked. That's why I spoke so poorly of him, and that's why I made the videos about him, because everything he's doing is fake. But wasn't addressed. What was not addressed is that when Benjamin Crump was a young man, somebody, probably a girl, and we're not blaming girls, but I'm just speaking honestly. A girl that he really, really liked called him
a gorilla, specifically, probably.
Well, maybe, but my whole point is they called him ugly. And that hurt. So when people call you ugly and other people are like, yeah, that person's ugly. That person's that person's really ugly. That hurts. That hurts. And
okay,
when you've been hurt, and it hurts. We live in a system where they get to tell you, you shouldn't worry about that. And your hurt is ignored and is minimized. But I can promise you that somebody called Benjamin Crump and said that he was ugly. And that hurt and that stuck with him. So when I realized what he was being a part of in selling out his community and embarrassing his community, I saw where he was hurt, and I attacked him on what hurt and called that man ugly. And I was wrong for that. Um, I apologize for that. I was wrong for that because I continued on a cycle. He is part of something that's currently hurting me, so I want revenge. And I just hurt him, which in turn is going to cause him to want revenge. You know, he got my entire channel banned because of that. But because I saw what he was doing, I wanted to hurt him. So I did what I knew would hurt him, called him ugly. Well, because I knew he was a part. But before I did any of those things, someone called Ben Crump ugly, and it hurt his feelings. And these are the people who they put in front of our existence and make our leaders and our representatives. Somebody called Bill Gates
scarred
ugly,
people,
terrible people that we were a part of, and we were not only a part of, we were in a society that celebrated the actions of bullying, discrimination, and all these different things. So we either witnessed it or were a part of it. So these characters that are coming up from our societies are homemade.
Listen, not just
It's a
that,
reflection of us.
but just to enter into a fake world. Because, all right, I want y'all to hear this one comment. I'm on X, and someone posted RFK Jr. in his own words, warp speed was an extraordinary accomplishment. I am not anti-vaccine. All my kids are vaccinated. Vaccines play a critical role in healthcare. And the woman's comment to the statement of RFK was, every one of these statements aligns with the establishment's narrative, not a true health movement. There is no such thing as a safe and effective vaccine. An Operation Death Jab has injured and killed millions. Now, RFK said all of these things, and this is my thing, right? Could a candidate actually get in the system? Could they actually get any position and say the truth? The answer is no. These people who are put in these jobs are literally put in a job where they know they have to lie.
Yeah.
It's literally the job. They have to lie. And we have to hope that he can get in knowing that he told a lie so he can just fix it and, just say, well, I had to say that just so I could get in. Because that's the other cycle that continues to go on. And this ain't just him. This is us too. We do it too. It's, well, let me go ahead and coax this situation so at least I can go in there and do the right thing, when we know that that's never, ever it's never how it plays out. It's never how it's going to go. And it goes back to that forgiveness thing, because it's like, we know why he's saying that. We know why he's saying these very deliberate taglines. Why else would he have to say it? What else are they questioning him about on that whole hearing?
It's all fake though. And it's
So he has to say, if you're going to be a legitimate official, you cannot go against any of these things. You can't do that. Right. He has to walk a funny line and say, but I believe this, I believe that. And it's just like, because nobody can tell the truth. It's just like going to court. Nobody can tell the truth during court. You can't just say what happened.
Because it's all a script.
Yeah. You can't just say what happened. And that is our whole entire world. That's why I was saying it. So, that is our whole world. Like, when we think that we're not politicking or doing all these things. We are every day. Every day. How many days do you go outside the house not feeling like being bothered, but you gotta go out to the store and then you gotta nod and smile and speak to people and you don't feel like being bothered. You do it. You have to keep some kind of whatever kind of balance in this program that we're in. Because if you don't, then you're going to offset something. Somebody's going to get offended, and then that's going to offset something, and then something else is going to build. And that is how this whole thing is structured. So all I'm saying is, if we know this, we'll just you're in the game. You're in the game. It's no way, unless somebody can find a way how to reset or shut down the system, you're in this motherfucking game. You're in it. So learn how to play the goddamn game. It really is Mario. It really, really is. And I guess I get frustrated because it's just like, yo, it's never going to be, if you gotta pick of how you want to get things structured. It's not something that you can just tear down. That's Hollywood. That's not real. That's not real. That's the shit that they do. You saw they did it with COVID. They shut the whole world down. That was some movie shit. But only they can do that.
Man, that's crazy. White people are cheering Trump for the immigrants. Like, it's like,
yeah.
Do you think,
yeah.
so you're telling me that the biggest priority that is on your priority list isn't the fact that COVID took place and all these jobs and people dying? That's not, y'all want to champion him sending illegal immigrants home.
Yep.
Like, y'all don't want, like, y'all, nothing. So the worst thing that happened to you in this past 4 years was the immigrants, huh?
Yeah.
Like, so
yeah,
them coming over here.
All this other shit wasn't going on.
Yeah, that's the
right?
worst thing that happened, huh? These people who are in the country through what you're calling illegal measures, that's the worst thing that happened. Nothing bad happened to you before that, huh?
Mm-hmm.
You know what's going on in London right now? All the folks in London, the white folks again, they're furious about the Muslim immigrants in the UK.
Yeah. Mm-hmm.
And it's like, so you mean you're telling me that the migrants that came to your country,
that's causing all your country's problems.
That's why your country's economies collapse. So all of the world,
mm-hmm.
Everyone's economy is collapsing. Just the Western Europe, the Eastern world is doing their thing. The Western world, all economies collapse, and it was because of immigrants, huh? It wasn't because the world shut the whole entire world economy down. That wasn't why people were in a bad state. It was because in Germany, the Africans came, and in England, the Muslims came. In America, the Colombians and the Venezuelans came. That's why everything is in a bad place. It wasn't because someone named Bill Gates, Fauci, WHO, CDC, UN,
NIH,
Klaus.
Yeah.
It's not because they told the entire world that if we did not get a vaccine, that the entire world was going to die. They said this to all of us. They hammered this shit through commercials. They had celebrities on TV selling their soul, doing vaccine commercials, promoting them. They had people giving away cheeseburgers and sodas and free bikes because that was saving the world. And if you didn't do it, the whole world was going to die. Now, if y'all heard this any other time, this would sound crazy, but y'all saw that they said that if we did not take this thing, that we were going to die. The whole world was going to die. Now, did the whole world die for those who didn't take it? Haiti. The reason why Haiti's at war right now, if anybody's curious, because
and their president was murdered.
President was murdered because
I guess
Haiti-
we forgot about that little thing.
The reason why they're at war is because Haiti couldn't afford to buy them. And coincidentally, COVID didn't show up down there. So things ain't, it's either truth or false. They said that we were going to all die. They showed us pictures of people in China passing out in the middle of the floor, dying. They said that everybody had to do it. And if not, we were all going to die. But we're still here.
We're
So
still
that
here.
makes
And the
them,
system is still here.
That
And the
makes-
election took place. All of this, I'm just trying to say, y'all, this game ain't shut down. This game has not reset. It is just putting new characters in. That is it. That is it. So all I'm saying is, don't be tricked in, picking apart. We pick each other apart. We pick each other apart like it's to our own disservice. It's to our detriment, the way that we pick ourselves apart. Because anybody who is going to fight back on the things that was talked about at that Kennedy hearing, it's literally just because of you have some other kind of interest or you just don't like a person. That's it. With that said, I know that he supports Israel. That is something that I don't like. But I'm not talking about Israel right now. I'm talking about this is the representative that we've been given to stop these vaccines and all of this enforcement. This is who it is. And if he gets killed, and I'm saying, hey, Donald Trump, all of these people, all of you people, I don't subscribe to y'all stuff, but if you allow him to be assassinated, which all of the numbers and the stars and everything is aligning for it to happen, you can forget any type of resemblance that America is actually trying to fix anything. This one thing, because you can't say that about any other thing. You can't say that about the border stuff because we know that shit. You can't say that about tariffs because we know that shit. You can't say that about anything. This is the one thing, because this is how we live. This ain't about jobs or nothing, because you can't get a job if you're fucking dead. Okay? So if you can't fucking eat your food, if you can't drink your water, if you can't breathe the air, if you're having a bunch of children with disabilities, you can't go anywhere anyway to work a job, you're fucked. That is the message that I am trying to get across. You're fucked.
It's all I'm saying is it's a trick. The trick is to keep shit going. It's just a bunch of instigators. People say things like every time, like it's not a coincidence that everywhere we're at war.
What's the resolution? Because it's like,
the resolution is for us to recognize that these are people who are doing these things.
Yeah.
And they come from us.
Right.
We
absolutely. Absolutely.
So we made them.
Right. So
we're responsible. So we're responsible. So we have to forgive because we made the monsters.
Yeah, I absolutely agree with that. But that's why I'm trying to relay the message. Like, please don't be deceived because you don't like an aspect of a person. And it can be an egregious aspect of a person. Like, I think the fact that RFK supports Israel and backs that whole ridiculous narrative is egregious. Like, because it's so many people dying. It's so many people dying. But just like on the airplane, you can't do nothing for nobody if you don't put on your mask first. I can't do nothing about what's going on in Gaza. I swear to God, I really wish that I could. I really, really, really wish that I could be right there to stop all of that shit. I wish I had the capabilities and powers and all of that type of shit. behind me to do that. But unfortunately, I can't. So I'm here right now and I need to survive because I got some shit to deal with because of what the system did to my children. So, in order for me to do that, I need to watch what's going on here. Not that I'm for, I'm not for any of these people because I know that none of them are right. But unfortunately, whatever reason, the creator made me a human and not some wild animal to where so I got to deal with this fucking system. When you were created and made a pure person, you were plugged right into this motherfucker.
So it beckons for us to take a look at ourselves. We have to look at ourselves, and when I say that, we ultimately we have to be nicer to each other.
Fuck yeah.
But the way to be nice to each other is we have to remove ourselves from these systems.
And stop picking each other apart, because that's what we keep doing. We keep picking each other apart, and nobody here is perfect. No one here is. No one here has all the fucking answers.
Right. Yeah. We got. But in order to do so, we have to remove ourselves from these systems, and we have to take a stand.
Yeah, but how do you remove yourself from a system?
Easy. We did it. It's easy, but
no,
hard.
But we're not. No, we haven't though. We haven't completely disconnected from this fucking system, because I'm telling you, I'm forever connected to this system because of what's happened to my son.
Right. So
it's no way that I'm not going to have a voice or speak on something.
I'm not saying that. I'm saying is this current system is imploding. And once this current system implodes, we can address our children, because we know that they're keeping people sick on purpose.
Well, that's what that Senate hearing was certainly airing out. Now we're not. I want to be clear. We're not saying that, but that hearing that we just watched certainly alluded to the question of those things happening. You know, people seem to be getting these turbo cancers and all of these things, you know, after being administered.
It's a system.
These medical interventions.
It's a system. It's a system. It's a system that's managed to control and grab other systems. But if we just take it out of politics and just look at us in our daily lives. Because we took part in the system, for example, we sent our children to school.
Mm-hmm.
Because we consented.
Right.
And that I said, okay, yes, we send our children to school. We are consenting to their traumatization.
Mm-hmm.
And it has happened to all of us.
But the problem is because no parent signed on for that.
No.
We didn't. Parents thought that they send their kid to school, their kid is not going to have someone come into school and shoot them. We did not sign up for this shit.
I understand. But
put your leg down.
But we still believe the system.
Yeah, that's why we sent them there. Yeah, absolutely.
So my point is, we know this system, and we should not trust this system or even allow this system to be in place to make decisions on our behalf, especially for our children. But because you went to school and you were traumatized in school, I went to school, I was traumatized. So now, are we forgetting that we went to this place and we despised it and we received so much trauma? So we should learn. And Leslie told us, we're not going to send our children there.
Right.
But it's been so normalized for us to be traumatized. All of you, humanity, black, white, indifferent, Chinese, don't matter. We've all been conditioned that it's okay to be traumatized. And this trauma is taking place at the schools. We have made trauma a norm. We've normalized trauma. And when we were kids, they told us sticks and stones to break your bones and things that have never hurt you. And now as adults, it's something different. They tell us something different. But we are repeating and we're making the same mistakes and falling for the same tricks. And the Robert Kennedy thing, it got Sirhan written all over it.
Mm-hmm.
It's the exact same fight that we had in the 60s.
Mm-hmm.
So what I'm saying is, everyone who's been to school has the same experience at school, and they hated it, and it was traumatizing. They had some type of trauma. Whether they admit it or not, you're put in a place where you have to be this type.
For 6.5 fucking hours.
Shit, longer. You had lunch. You had to be, you went to a place where they told you to be everything but what you are.
Yes.
They conditioned all of us to be everything what we are because we didn't learn anything in school. We learned some.
Listen, you gotta ask to go to the bathroom.
That's my whole point.
You know, everything is just.
In school, the thing we were taught more than anything else was to sit down and shut up.
Yeah.
We were taught the majority of your time in school, you were sitting with your mouth closed. And you had one person who got to dictate everything that went on in that classroom. Now, if you had a nice teacher, then that teacher wouldn't allow certain things to take place in that classroom. But even with a nice teacher, you have to sit down and shut up. We were trained for the most impressionable years of our lives, where they're the most malleable, that we need to sit down and shut up. And that's trauma to all of us. And the hardest thing in the world for me to do is to shut up. Me personally, is to shut up, especially when something's going wrong. But everybody still went along with it and sent their kids to school when we all knew and that the trauma that takes place. But because we were able to dismiss your trauma, you even dismissed your trauma as well and get to say, well, that happened when I was 12, I'm a grown man. But that trauma never went nowhere. You're still traumatized and don't even know it. Like, it just dawned on me a year ago that you shouldn't fight people.
Look at this. Can y'all see that? That's the border. That's the border going on right now. Like, this is what's priority. This is why America is broken.
This world.
This is what they are trying to say is the reason that America's broken.
So we normalize these things. It didn't dawn on me to, honestly, like 2 months ago, that I can no longer fight and physically fight people anymore. It was because I grew up with violence and grew up with violence throughout my life. I thought it was a part of life. And if I talk to a man who's 40 or 50 years old and he's never been in a fight, my immediate thought is, that guy must be a weirdo. Like, how do you go through life and never been in a fight? I normalize fighting where it's a great option. Talking things out is the best option. I've always preferred to talk things out if necessary. But if you say something too slick out your mouth or you're posturing a particular way, hey, fighting is the second best, and man, do I love that. Give me the opportunity to fight, perfect. And I didn't even realize, hey, that's strange. I know it sounds stupid, but I swear to God, I've been conditioned to accept violence and to issue out violence. And it's like, man, how did you, smart guy, enlightened guy, get conditioned to think that it's acceptable? Well, it happens to the best of us. So what I'm saying is, if we're being honest, the reason why we are not standing up is because we love, let's be honest, you're like, right, but they love this system. You know, you're not, everyone sees what's taking place, but are you willing to sacrifice some discomfort? Of course, of course, but
No, it's not that everybody loves the system. Everybody loves the hope of what the system should be.
that's part of it. But for the people who know stuff is going on, know the system ain't working, they fear by speaking up that the system will do harm to them.
Yeah, retaliate.
Right.
Like they do us.
Right. So they're afraid of that. And unfortunately, America is having a birthing moment right now, in particular. When things was taking place in Africa, South Africa, people stood up and spoke out about it, and enough attention went into that information that it embarrassed the government and made the government stop. Okay. You don't realize that we're in it. We're here. We are in it. We're going to need somebody to speak for us. You know, you got places around the world who are just counting down the days for our total collapse, and like are openly like, "Oh man, we're not worried about y'all. Y'all gonna be around a little while longer." Like people, everyone sees it, and that's why the movie "Leave the World Behind." They were letting you know that what happens to us is based on what we do, and I believe that the majority of us want revenge. I want revenge.
Me too.
And me getting my revenge is going to make me feel better for a while. But the people who did it to me have family members who love them. So in turn, their family suffer. So we have to take control of this. And these are words. They don't mean anything today. This is for the future because no one's ready to hear this. At some point, you have to cut your losses and just stop.
Yeah.
We've, society-wise, have crossed. There's nothing.
We lost.
We've crossed all of the lines.
We certainly have lost.
We've crossed all the lines. There's nothing sacred anymore in this land.
And you need to not feel like we lost and they won, because they lost too.
Well, because they
lost too, because
they wanted to win. They wanted us to lose, though, because this is.
But what I'm saying is, but they didn't win either. They didn't win. They lost. They lost. They lost too, because guess what? All of these people.
When you say they lost, can you explain? When you say lost, do you mean the system, or do you mean the people who did the bad thing?
The system, the system, and the people who did the very bad thing. And let me tell you why. Because guess what? Only maybe a small handful of them actually wanted to do something horrible. A lot of them were a part of something that they thought they were going to do something good. And then they got involved in things, and things spiraled out of control.
True. Very true.
So they lost. They've lost themselves too in this process. You think all these people who we talk about doing all these rituals and all of this shit, you think all of them just initially went into this thing like, yeah, this is, fuck no. No, that's not what happened. So everybody lost. Everybody lost. The question that we should be asking right now is, okay, we all lost. So how can we work towards fixing some shit? Because nothing has ever gotten fixed.
We did lost. You're right. We all lost.
Yes.
We all
all lost.
Everybody lost.
Yeah. So it's like, at what point everybody's fucked up and panting and bloody and dirty. Everybody dirty. Everybody dirty. Regular people dirty. Elites dirty. Everybody dirty. and tired and pretending. So at what point do both sides continue to be psychopaths? Because that's what we are and that's what they are. Or is one team going to say, okay, this is pure insanity. We never win. No one ever wins. The only resolution that any of these people who make decisions come to is it has to be bloodshed.
And understand.
It's recycled. It's over and over and over again.
What's crazy is this. How do you, you really understand that our government's and systems answers to fixing a problem is to go and kill.
Yeah.
You understand this Ukrainian
That's
war?
it.
Over 1.5 million people have been killed in this war. Are you telling me that we're supposed to be so smart and we're supposed to be able to go to Mars and we're supposed to be able to read people's thoughts, but the only way you can fix a conflict is to go to war with a country? We're not more sophisticated than that? You mean the only way to fix something is through a war? You mean that's how sophisticated we are? We're calling ourselves smart, but saying that the only way to fix something is to kill a bunch of people. Forget whether it's fake or real for a second. Pretend that Saddam Hussein had weapons. Let's pretend for a second.
Exactly. Somebody said Freemasons are chemtrailing themselves too. That's my whole point. Do you understand how sick these people are? Yo, do you hear RFK's voice? He didn't sound like that before. Ronald Reagan got Alzheimer's. I didn't like him, but he was sharp.
Prior to
the Alzheimer's.
Bruce Willis, he was doing movies,
Yeah.
action movies.
Right.
And understand he's up there in age, but he's been doing action movies, and then he received a particular. He took something. He received the vaccine, and now he's lost his mind.
Yeah, so it's not a situation where it's this. They fucking themselves up. They killing their kids. Their kids are dying. Their kids are having special disabilities. This is no one's winning.
But just what I want you to understand, for you, I want you to understand that something happened to them that was so terrible that they were willing to give up a big piece of themselves to stop feeling that way. For me, when I go places, I was in the Philippines a couple months ago, and it's normalized for children to be walking around hungry and barefooted.
Mm-hmm.
That's normal. It's normal for people from other economies to treat the Philippines like a big prostitution ring.
Mm-hmm.
You
and
understand?
down in South America.
But you're right. But when I go to the Philippines, and the little girls are dating, a 16-year-old little girl was dating a 70-year-old man from Germany. So what I'm saying is that 16-year-old little girl has been treated so poorly throughout her life that she's believed the things that's been said about her and is willing to give up the only part of her that's beautiful to not feel the hurt that she experiences as a child. The same for that African who broke my ribs on the plane. He was treated so poorly where he was from or where in his life, something hurt him in a way that me and you don't understand. We don't understand the trauma that we received. You don't understand the trauma they received, and I don't understand it because what happened to them was so traumatizing and made them resort to do the unthinkable to not deal with their trauma. So we got to feel sorry for them and be prepared to forgive people, is all I'm saying. And because all of us have participated in the system, and the thing about it is, if we're being honest, no, we don't have to participate in the system. We can go somewhere and have a simpler life. But because we want these amenities, we want the nice houses, nice cars, and the titles and the things that make us feel like we're doing something right. But in order to do so, we have to participate in a terrible system. So we continue to do it.
That is not functioning properly.
So
that is embezzling money. It's propagating slavery, sex trafficking, all of these things. We know that is how we know the inner workings of how this whole thing is running. We know. And we continue to participate in it because we don't know another way.
Right.
Because we're just stupid humans.
So this here is a pathetic attempt to earn your trust back. And in turn, it will earn trust back for a lot of people, but in turn, it does keep the killing of the people in Gaza. So yeah, we fixed something over here, but that problem that develops continues to develop. So we're only getting half of what we really want. And what we want is we want it to be over. And what I'm saying is, us humanity, look at ourselves and look at this one thing, please. And I'm not trying to sound self-righteous, and I'm not trying to sound judgy, but we're hypocrites, and all of us are hypocrites, because we have failed the most fundamental thing that all of us are supposed to do, and that's to protect babies. Every last one of you, every last one of us. When a child is missing and you hear about a child missing, what do? What did I do? I would look at my phone and say, damn shame. But did I get in the phone and call around to my neighbors and my family members and say, hey, take a look at this picture. This child is missing. Did I call the police? Did I drive around the neighborhood where the child was last
And
seen?
you know what the parent says, that whose child is missing? They say, you would have did it if it was your child. And the answer is, you motherfucking right. You right.
So because we are in this thing where we're so tribal, all of us are so, we ain't sophisticated at all. We are a tribe. We're tribal. We have gotten to a place where we give excuses and set conditions where it's okay to kill a child. And because us haven't done anything about it, then we've opened ourselves up to the same thing happening to us. We're setting ourselves up, because if we can't, like, if we started a petition today, it wouldn't be successful. If we say no murdering children, if we just leave, that's a standard. If we could set a standard, okay, if we can't agree to nothing else in the world, if we can't agree whether it's Israel, Palestine, black, white, Jewish, Israelite, Muslim, we can't agree on nothing else in the world. Can we at least agree that there is no reason in the world to murder a child? And I'm not even getting to abortion at this time. But because that's what someone's going to say. Someone's going to be able to say, well, do you believe in abortion? I'm speaking of, is there any circumstances ever in the world where we should say that it is okay to murder a defenseless child? And the fact that we cannot say that, we can't say that, because we don't have one standard. There's nothing higher than that. There's nothing higher than protecting a child's innocence. And by the way, it's our future. If we don't protect them, look at the future. So fundamentally, we've all failed, and we've all turned off our something in us that makes us be okay when we hear that, like, yo, you put a kid in a cage, yo. So you telling me that it was a good policy for the president to let Mexican children be in a cage? Like, if you think that's okay, take a look at yourself if you think that's okay. Because you wouldn't want to be put in a cage, and you damn sure don't want your kid to be put in a cage. If we could just have one standard that says, okay, we can't do this to children, but we can't even come up with that one standard that we can't do this to children. So we lost. We lost because what are we doing? We just are watching. And these people who we've allowed to be in charge of our lives, these people we allow to be in charge of our lives don't like us. They don't care about us. They are not us. We're not economists, but would you prefer them take $500 billion away from NASA and give it to your community? Where would you rather for that money to go? I would think most of us would say, well, that should go to us. That should go to make sure that people aren't hungry. But we let it go to NASA. And why do we let it go to NASA? Well, Americans were happy in the 60s because we wanted to go there before the Soviets. So they put their pride on wanting be able to say, as American, we went to the moon. We live in a system where they prioritize, that's part of their budget, for people to experiment to fly to the moon or to Mars. And we don't feed people who are poor. And we have a homeless problem. Case in point, let's say you got 100,000 homeless people in Baltimore City, my city. There's homeless people, 100,000 homeless families. Well, there's over 200,000 abandoned houses in Baltimore. And we have leaders who run my city in Baltimore where no one ever said, well, hey, if we got 100,000 people, families that are homeless, and 250,000 abandoned houses, why don't we just take the people who are homeless and put them in abandoned houses? If any one of you who are listening were running a city, and you had a city where your houses outnumbered the homeless, you would say, well, if they're homeless and they've got abandoned houses that is greater than the homeless, then why don't we put the people there? We can't put the people there because the people who are lucky and are working in the system, who have jobs, are then angry that a person gets to live somewhere for free and they got to pay rent. So that's why they don't fix it, because they got your support. They know that you're going to resent the fact that you get up every day and you go to a job that you hate to pay your bills. And the people who didn't do these things, this is my beliefs, but the people that you perceive are not doing all these things are living somewhere for free. And because that is your belief, you allow the people who are making your decisions to make these poor decisions on your behalf. If you don't believe in energy, if we can all believe that all these are just energy exchanges, what energy is going to be generated from a country going to war with another country for weapons of mass destruction? We know it's Iraq. And then once they find out that the whole thing was a lie and there were no weapons, to re-elect the president who did it. Like, you understand that George Bush got re-elected after he went to war with another country and the whole thing was a lie and he got re-elected. That isn't a reflection on George Bush. That's a reflection on the state of the country. The fact that Henry Kissinger committed genocide in Laos, Vietnam, Cambodia, places. He committed genocide everywhere in the world, but he gets a seat with the leader of the free world and medals and honors by the Medal of Freedom, and he's massacred and murdered and killed so many people. Shows the condition and the state that we are in. That for Bill Gates to poison every place he goes to, if you go to India and you go to Vietnam in particular, the Vietnamese health officials will tell you that we did not have we did not have the thing that they're calling autism. We didn't have any of that until Bill Gates showed up. India is saying the exact same thing. But he is having lunch, a 3-hour dinner with the leader of the free world. Well, y'all put him there. And you've accepted that as long as it doesn't happen to me, it happens somewhere else is fine. Well, y'all know it's energy. Y'all know that all that comes back. All that energy, everything is recycled. We come back. That's why we keep doing the same things, because we keep being born. It's recycled. You know it's going to come back to us. The conflicts that were started in the Middle East in the 80s, you know, when Russia invaded Afghanistan, America came in to save Afghanistan and gave the Afghanistan people weapons. The people they gave weapons to were called the Taliban. So we created that. So now you got this thing that we created wanting to go to war with the people who created the problem. It's all revenge. Everybody is angry and everybody wants to get back. And that's the trick to keep it going. You're going to have to make a hard decision. And it's hard, but you're going to have to, the hardest, forgive. And the people who I'm saying that you got to get away as best you can. The things you're trying to hold on to, they're taking everything. They're taking your house, they're taking your car, they're taking your job. And it's pretty clear. But you can prepare yourself for a simpler life where you're not dependent on this system. But that's hard, and that's a hard ask. But forgiving somebody is even harder than that. It's nothing harder than forgiving, and that's the test. The test is forgiving. And like I said, if I was passing that test, I wouldn't be here. I would have ascended and flew out this motherfucker a long time ago. I would have been out of this a long time ago. But I can't forget. And I'm supposed to, you know. I've forgiven a lot. But there's certain things, this whole thing, I'm looking fucked up today, especially that hearing really triggered me today. Because I'm living as a result of my actions and my choices, because I chose to be within this system. So I'm living with the decisions that are made because of being a part of the system and going along with this system. And I know that the system is lying, because this is real and what you saw wasn't real. But for my own health and for my own development, I have to forgive. And I'm not talking shit to y'all like I've mastered it. I'm just saying that the one impossibility that they've made in this system is they've made it impossible to have any reconciliation and forgiveness. And with the reconciliations, as you see, you're not going to get that. If you're Black and you've been in America long enough, you will, people who are living Black in America were born into a system where they knew they was going to be treated like shit, and still ain't getting an apology and still getting subjugated right the fuck now. And if you are a woman, you are born into a system where you are second. You're born into that shit. You're stuck into that system and still haven't received an apology. And are so indoctrinated as a woman that you don't even realize how fucked up your species have been treated. My opinion, the man and the woman, we're both similar beings, but we're separate species, female and male. And we've been doing things so long, so wrong, that we've normalized it. And it was first done to the woman. And men collectively, all men in the world should apologize to women. Every man in the world should apologize to women, and on the behalf of other men, because where all this came from, it all came from the foundation, and it all comes from all of our foundations. And with each of the foundations in particular with us, we're religious folks. You're hypocrites, but we're called Christians, Catholics, Muslims, Jews. We call all of these things, and what all of these things have in place is we all share a story, and we all believe in this story. Not me, but we all believe in this story, and we base our life on this story because this is supposed to be our foundation. Whether it's the Quran, the Bible, the Kabbalah, the story is that Eve ate this fruit, and God made man first, and the man is supposed to head the household. And this has been said so much throughout history that women have been brainwashed and have been pimped. Like literally, women, there's going to be a lot of women that hate me saying this because of the conditions they were born in, that they've been taught to normalize. But the very first act of discrimination wasn't some white man picking up some black man and calling him a slave. The very first act of discrimination was all of y'all's Bibles or Kabbalahs or Qurans. When we made a decision that we were going to make the man the head, that means that he's number one and she's number two. If he's in control of things and he's the decision maker, the man, then that makes her number two. It's like us. It's like, you know how they tell us that we pay their salary, so they work for us. Yeah, the police. You know, if we go talk to a police officer and say, you're not allowed to arrest me. I pay your salary. You work for me. That police officer will whip your ass and can arrest you. And it's like, well, this thing that they're saying is the law is truly not the real law that anybody's following. So if we're allowed to say that the man is the head of this, but yet in order for a relationship to be balanced, we're saying that the male and female relationship is supposed to be balanced. But if the man is the head of things, that means there's not a balance. That means that he is the controller of it. It's a fake narrative. We have been conditioned, whether you're Christian, Jewish, Catholic, or Muslim, that the man is the one who's supposed to be able to make the final end-all decision. And we call that balance. Like, if you take yourself out of it and just ask yourself a question, if the man always gets the final word, is that balance? Like literally, you're saying that this person gets the final word, but everything is balanced. And because we accepted that first thing, that first thing with the man being the head of the household, that was the tenderizing of then allowing, well, we can't accept that person because they're fat. We can't accept that person because they're too dark. We can't accept that person because of their hair color. And I know all these things sound stupid, but y'all understand that for everything that's done, there's a precedence for it. Before somebody got to say, hey, because those people aren't Christians and got nappy hair, we're allowed to enslave them. Well, these exceptions that got made by them is the exact same exception that was done to women. So women are in a fucked up state, and it's terrible all the time because women don't feel safe. Women can't express themselves because the man is going to get the final word, and if he don't like the final word, violate with her. So women are conditioned to shut up, to sit down and shut up for fear of repercussions, because men have demonstrated that if you don't do what we tell you to do, we will beat you or we'll go to war with you. But by doing that first precedented action of saying that the man is the head of the household, we started, that's the very first act of discrimination when we said that, because then it allowed for something else. It allowed for a man who doesn't have 1,000 pieces of gold for the dowry cannot get married. So that means that if you are poor and you love this woman and she loves you and neither one of you have nothing, you aren't allowed to get married because you haven't provided enough funds to be able to marry that woman. That's discrimination, because that's discriminating towards the poor. It's subtle. If we're watching it right now, it's subtle, but it gets ingrained, and we start calling it heritage, and we start calling it history, and we start celebrating these things. But look at Karen. Look how we've shitted on white women, and we call them Karens now. So now anybody who gets in an argument with a white woman now can call her a Karen and dismiss everything she says, and it seems subtle. It seems like a very subtle thing. But white women better start talking about letting people call them Karen, because they don't realize Karen turns into nigga, and it's hard to shape nigga. So if white women know, like I know, when somebody calls them a Karen, they need to say, I consider that a racist epithet. You're discriminating against me. I consider that racism. You better start doing it, because you have no idea how long that shit sticks with you. I've been a nigga since my great-grandfathers. We still haven't shook nigga. When we was kids, the white kids told me that the Chinese people were eating cats and dogs, so don't go to Chinese restaurants. And guess what? We believed it. So it took 15, 20 years of becoming an adult and meeting with these people and realize all that shit was a lie. But you know how long it took to shake that shit of people looking at you like you eat dogs, and it got to happen just because one person said that somebody did it and we accepted it? It's all discrimination. But what I'm saying is it started with putting the man at the head. And if you're not sure about how it started, look at the world and we see the heads of all these nations of men, and you see that they are all in charge. If you look logically at what's taking place, in my opinion, you will see that the world is being run by men. And if my opinion, if you're looking at the state of the world, you'll see that these men are cruel. And they subject their subjects. All of them. Not saying you don't have your Angela Merkels and your Hillary Clintons of the world, but I'm saying we already see what happens when a man and all men are allowed to run the show. You have people killing babies in Palestine. You got 3 genocides taking place in Africa right now as we speak. You got Mao Zedong starved 30 million people. The men are doing it. And we're living in the Tower of Babel right now. For you folks who like that Bible, we're in the Tower of Babel right now. And when I was a young man, even until I was in my 40s, I never liked the story. And I didn't like that the creator changed their language. But the creator changed the language for a reason. The creator knows something about men, something inside of us. No matter what's going on, whether you're preaching the gospel, whether you're playing football, whether you're playing soccer, whether you're playing darts, whether you're swimming, whether you're fishing, if you put a bunch of men together, every time, no matter what you're doing, it's always a fight. No matter what it is, you got men fighting in church. You got men fighting at funerals. You got men shooting up people at other people's funerals. You got these things that's taking place because we said that the man is supposed to be first. I'm not saying that the woman is supposed to be first. I'm saying it's supposed to be a balance. And because we've allowed the discrimination to start back in our Bibles and Qurans, that we've taken this and put this into society where men are given the decision-making power, which is discriminating against the woman. The Tower of Babel, you had men getting together with a plan to destroy God, because that's what's going on. You got your Musks, you got your Gates, but mainly your Musks and your Trump with Stargate, because they want to come and tell you that there's aliens, and a bunch of aliens made us, and we didn't have a creator. That's all they're doing. They're doing the exact same thing. That's how you kill God. If you wanna get people to stop believing in a creator, just have a bunch of aliens come up the sky who are more advanced and say that, hey, we made you. There is no God. We made you. That's what they're doing. That's the whole Operation Bluebeam. They're trying to get us to kill God. And you're God. All of us are God. Whatever you want to call it, we are all God. That piece of God lives in all of us. And they're trying to get us to go away from God. And when you kill God, you kill yourself. Whether you call it Allah or Jehovah or Yeshua. So all these things are taking place because we allowed discrimination to take place in a form, and it became tradition. The discrimination that's taken on so long, it's been going on so long that it's now tradition. It's tradition for the man to be the head of the house. Well, what's wrong? What happens with the woman that's smarter? People who follow me know that I'm into the artwork, and I've been struggling with the Vitruvian Man, a picture, for the past 5 years. Vitruvian Man done by Leonardo da Vinci. And I couldn't figure it out for the life of me, and it was the one picture that I studied for hours upon hours, and I couldn't figure out the Vitruvian Man. But because we're in a simulation, and this is part of this story, I had the ability to meet a woman and found out that the Vitruvian Man is not even a man. I met the Vitruvian Man, and I talk to the Vitruvian Man once a week. The Vitruvian Man is a woman. I wasn't going to get into this, and please walk with me on this. I was not going to get into this with you. But if we know where it started, we may be able to recognize it in other forms. The reason why I'm trying to demonstrate this is because we've allowed discrimination to take place. When we say discrimination, we always think about black and white and all these different things. But discrimination takes place in many forms, not just the ones that we're speaking of today. But give me 1 second to show you something. All right, so this here is called the Vitruvian Man, okay? I've been trying to break this picture down for 5 years. I had to look at it for a couple hours and had to keep coming back to this. And this has been going on for 5 years, and I couldn't get the message behind this picture. And the reason why I didn't get the message behind this picture is because I needed to have a particular experience in order for me to truly understand this picture. Am I sharing this? Okay. I'm sorry, folks. Give me 1 second. I apologize. Share. Slides. Present. Present. Hey, baby. I don't know what I'm doing wrong. Oh, stop sharing. Stop sharing. I'm trying to share. I'm sorry. Share. All right. I'm sorry. All right. This picture here is called the Vitruvian Man. And I was trying to figure this picture out for 5 years. And I just couldn't get the message. I couldn't get the message. And I wasn't going to get the message. There was no way for me to ever get this message without having experience. And this is the Vitruvian Man. And if you listen to the art scholars and the people who got the fancy titles behind their names, and they try to explain this to you, they're going to tell you that this is Leonardo da Vinci's attempt of showing what a perfect human being was. It's trying to show the human, the perfect architecture for the perfect man. So I've been trying to figure this picture out
It's true.
for 5 years.
If that's supposed to be a depiction of the perfect human being, and it's representing that, then it is.
But Da Vinci said this is the architecture for the perfect man, and it's called the Vitruvian Man.
But we're all man.
Right, but this is sexism. But my point is, this picture of the Vitruvian Man, you've seen it a million times, and it's a unusual looking picture. It's an unusual looking picture. The person has four arms and 4 legs. But what most people don't realize is this picture is originally a picture of a woman. And what took place is what you're seeing in the Vitruvian Man is the man putting himself in front of the woman. That's what the Vitruvian Man is about. If you look at the left pec, you see that's a man's chest. But you look at this one, you see it's more rounded because it's a woman's breast. You look at the hips on the man don't have hips. But you look here on the right, you see his hips here. Because this is not one person, it is 2 people. It is a man and it is a woman. And what this is showing you is that this is where everything started. When we made it and we put the man in front of the woman, then we threw out the balance. That's why you see the circle and you see the square, and you see the circle doesn't fit into the square. Parts of the square has circles and parts of the square. And see the parts of the circles outside the square, because you threw off the balance when you put the man in front of the woman. There's a woman in this picture. The reason why I wasn't able to figure this picture out for 5 years is because I did not meet the woman. And that's what let me know. There's an amazing character out here by the name of Vian Ibrahim. She is, Vian, forgive me, please. She is a character who was created by circumstances that were beyond her control. Her name is Vian. And this character's name is Vitruvian Man. And what it's saying is the person who is in this picture is a character by the name of Vian. Virtuous Vian is the actual name of the picture. Virtuous Vian. Put it in the chat. The actual name of this picture is Virtuous Vian. And there's Da Vinci's drew this picture. It states that he drew this picture because he was a big fan of an architect, engineer by the name of Vitruvius, because Vitruvius used to build foundations. It just so happens that Vian also is a architect and an engineer. Oh, I'm sorry. Okay, I need to see the picture.
No, I'm just saying
Type it in.
you
Virtuous-
wanted,
virtuous Vian.
yeah, they can still see the picture.
Virtuous.
Uh-huh.
I told y'all who people who follow me that the people of today are in the artwork. They are living today. The Renaissance art Basquiat, these people they're showing you are living today. This character right here is a person. This picture was painted 500 years ago by Da Vinci. This character is alive today in the UK. Her name is Virtuous Vian. Her name is Vian Ibrahim, and she is Muslim. So Da Vinci, 500 years ago, drew a picture of a woman in the UK by the name of Vian Ibrahim. And she's alive today. But he drew the picture 500 years ago. Vitruvius was an architect and an engineer. Vian is an architect and an engineer. Even in the name Vian, Vian is a very amazing character and very virtuous and follows that Quran to the letter because she's a virtuous woman. So that's who they're talking about. They're talking about a character by the name of Vian, Virtuous Vian. And Vian's character was a character who was traumatized. And we confirmed, I showed this picture to Vian, and we confirmed that this is her, and she also confirmed it. Because Vian lives in the UK. She is an Iraqi national. She's an Iraqi national. She was born in Iraq. But she was forced to leave Iraq. And she was a civilian, all her family was civilians, and her community was civilians because the American government bombed her country. And in doing so, they killed her siblings who were twins. And these two babies in the stomach that are facing one another, the baby here and a baby here, and they're holding hands. She carries this trauma with her to today. She's literally carrying her twins' trauma today. And that trauma that she received turned her into the character that she is. I wish people would stop fighting me and just would look. But the woman, her name is Vian, and she has a channel. She has a YouTube channel, and it's called Spiritual. What's it called? Spirituality. That's some kind of it's on YouTube. Okay. I'm gonna pull it up for you. It's just on YouTube. Spirituality. I'm spelling it wrong. I'm sorry. Vian. Can we spell spiritual, right?
Yeah, but it's like
the end, right?
spirituality and unity or something like that.
But it's
Or maybe it's unity spiritual. I don't know.
in our feed.
I don't know, baby.
Okay, spirituality and unity.
Slash unity. Slash.
Find it. I apologize. This clearly, because this is real, we didn't plan on having this discussion or any of these kind of things. This was not part of our plan. We just wanted to, we had to say something because ain't nobody out there telling the truth. And all these people who you watching on TV, we've spoken to these people. I've got more than 3 hours of recorded footage with RFK's organization, CHD. So we talked to all these people. This woman, we got to pull up her.
I'm trying.
This woman was traumatized as a child and had to leave her country because our government killed members of her family. And guess why? They said that a man by the name of Saddam Hussein has weapons of mass destruction. You understand? They said a man by the name of Saddam Hussein. I want you to understand the impact of what happens when we go along with this lies. A man named George Bush said that America had weapons of mass destruction. And as a result, we spent money to allow our military to bomb a country and kill a bunch of people. And because of that, these twins that are in this belly holding hands is a trauma that's being carried by a woman by the name of Vian Abraham. I'm gonna find you her channel. And despite the trauma that was inflicted upon her, she does a weekly show speaking and teaching people how to be spiritual and more spiritually connected. And she's having a hard time doing the show because no one is watching her show, because don't nobody want to hear that shit. We don't want to hear that shit. But she has an important message, and it doesn't have anything to do with Islam, Christianity, Catholicism, Judaism. She just has a beautiful message about how we're supposed to be conducting ourselves as spiritual beings. It's not corny at all. It's simple, it's honest. She's not gonna say some things that may hurt your feelings, but she's a virtuous woman. She's literally, Vitruvian is virtuous being, this particular person. But I want you to understand that what you're looking at are a set of twins that are holding hands. And this is the result. The Vitruvian man picture that you've been listening to, that you've been looking at for the past 500 years, is talking about this woman by the name of Vian. This is her channel. Subscribe to her channel. This doesn't have anything to do with religion. It's all about getting back to the basis of learning to respect people. And we don't have that in America. We don't have a system, a person involved in a system that says no killing babies. We don't have that. Subscribe to her channel, go through her videos, and her message is not being pushed, and she's being throttled and she's being suppressed in her message because the message she's giving is the message they don't want us to get. And that whether you're white or black, we are all in this place and we are all connected. We are all connected. we made a mistake when we started calling things trees and rocks and mountains and water, because all of that is necessary for survival for all of us. We're all connected. And that's what she's trying to explain to us. And we should listen to our inner child, our inner voice, and be honest. But go to her channel and start watching her stuff and support her, because she has a beautiful message. She has a meeting every Friday to speak on spirituality, and she lets people talk, and she hears out, and she doesn't allow any profanity. She don't allow any profanity. She doesn't allow anybody talking about things of a sexually charged nature, of pornography. She don't do that, because she's a virtuous woman. And because of that, she's someone who we should be wanting to listen to, instead of listening to other people who've been put in front of us to see. And me personally, if for people who have more than 100,000 of these big accounts, don't you understand that if you have a big account and you're getting monetized, that you're pushing the agenda that they want? Because if you're monetized, you know that before you get monetized, you got to send your videos to YouTube, and then YouTube removes the part that they want you to say. So it's a situation where they allow you to put things out for a narrative, but they remove anything from the video that goes against what they're saying. So this is their way of just paying you and silencing you to stay quiet. But I'm about to end this thing and just say, hey, what is happening over here is real. Those people who are on TV are liars. And they're doing it to me, and they're doing it to you. And if we go along with it, continue to go along with it, the things that we watch happen to someone else, you're not going to be able to fix because you watch someone else do it. Everything is being put in place just to keep the fight going. At some point, someone's got to say, enough, I forgive you, let's start over. And that's a tricky one. And maybe, you know what, go and listen to Vian. Go watch her channel, because she has, she's forgiven. She's forgiven for what's happened to her. I don't have the words, and my heart hasn't been fixed, hasn't been healed enough to forgive. So what I'm saying is, this is a trick to keep us from not forgiving each other. This whole thing's a trick to get us not forgiving each other. But I'm at this particular moment, I'm not the best spokesman for this message. So I ask you to go to her channel and listen to the message that she's giving, because her message is superior to my message. Because honestly, they just want to keep a fight going, a never-ending fight, that if we were making decisions, the fights wouldn't exist. You got 100,000 homeless people, 200,000 vacant houses, put them in the home, put homeless people in the 200,000 houses. That's what any of us would do. But our system don't do that and let people be homeless. So I'm saying we have to learn how to forgive. And because I'm being a hypocrite telling you to do so, I'm asking you to go to her channel and you watch her channel, because she has a superior message than me, because we gotta forgive, and we even gotta forgive even without an apology, which I struggle with. I'm not there yet. And I'm giving you this message, and I'm telling you this message because I know the trick. And just like you, I am struggling to forgive, but I know it's the answer. If they make it unreconcilable how dirty and disgusting this system is. Like they killing babies, man. They raping, they kidnapping children. They're doing the most disgusting things. They're making the things they're doing unforgivable. It's unforgivable. But she's a person, a virtuous woman, virtuous being, who still managed to still remain beautiful, and she forgave. So listen to her message. She got a better message. So I know it sounds crazy, me telling people forgive, knowing how vengeful I am, knowing my lust for violence. So I'm just telling you, I know that I'm sick like y'all. We all suffer from this thing of wanting revenge, and it's justice. It's justified. It's justified. But the result of revenge breeds more revenge. So we have to get to a point where we just say, all right, fuck it. From this day forward, let's just start today and just forget what happened. Forget what happened. And that means leaving the system alone. Forget what happened and starting over. Because any answer just leads to further revenge, further killing, and further degradation of our souls. Because it's about our souls. We're losing our souls when we are watching these things take place. When we watch people go homeless, when we watch people be hungry, when you watch children get abused, when you hear about children getting abused, when you hear about a missing child, and we don't stop our day and say we got to stop everything we're doing to find out where this child is. We're going along with it because that child is your child too. That's your child too. You're connected to that child. But we lost our connection because of discrimination that started with the woman. Because once we allow one type of discrimination to take place, we set precedents to allow another set of discrimination to take place. And when we decided to say that the man is first, that's discrimination. And it's been discrimination so long that we stopped calling it discrimination and we call it tradition. We're supposed to have a balanced relationship. It starts in the home and it goes into your job. It goes out in the streets. It goes on vacation with you. It's supposed to be balanced. All of our governments are all run by men. So we need integration in the decision making with women equally. And her role is just as important as a man's role. We made man more important by making the world violent. But what's more important than raising children? If it's up to me, my personal Santana opinion is that if God was saying any of us who was better out of either one of us, I would say if we had to make a choice, if we absolutely had to make a choice and ask who God favored more, I would say it's common sense that God favors the woman more. It's common sense to me because we know God favored the woman because God gave women the baby. If men were supposed to be the best and the greatest, then God would have gave the baby to the man. But there's nothing more important in humanity, the universe, or anywhere than the baby. Whether you believe in God or whatever you believe in, there's nothing more important than the baby. And the job of having the baby was given to the woman. So you don't take the most important job in the world and give it to the second best. You give it to the best. I just think that's just common sense. Like, that's the craziest thing to me. It's like, if we're superior, why we ain't get the kid? The woman got the kid. But even with that being said, I'm saying that raising a child and making it into a beautiful person, so that beautiful person can go in the world and be beautiful to make the world beautiful, that's done by the mother because the mother comes from this child. So that's the most important job. Well, they gave that job to the woman. So God knew something. He knew something because we see what happened when men are allowed to make all the decisions. So what I'm stating is, if it's supposed to be balanced, it's supposed to be true balance. That everything that she says is as important as what he says. So if we can't agree on anything, can we at least agree that if the man gets the final word, that's not balanced? So we have a tradition of keeping all relationships out of balance. It's our tradition to keep them out of balance if you step away from it and just look at things from a perspective of, is that true balance? Well, do you think it's balanced when you tell the police, hey, I write I pay your taxes, but he can kill you and he can put you in prison. He can put you in handcuffs. That's not a balance. That's an imbalance. Well, when we say that a man gets the last word and the relationship is balanced, then that's not balanced because the person who gets the last word is in charge. That's not balanced. So, I just wanted that to be said. I want it to be said, and I want to say that when we allow little things happen, we're giving room for the big things to happen later. And when we put the woman behind the man, then we allowed putting fat people behind the man, or fat people, or ugly people, or short people, or skinny people, or gay people, or anything. But that's where the foundation of the fuckery started. This picture, the Vitruvian man, and it's the man standing in front of the woman and putting the woman behind. You're looking at a man standing in front of a woman, and her name is Vian. I've talked to her. She's a beautiful, beautiful human being. So, for those who I may have offended, I want to do a public apology. For the people who I've talked bad about and made videos about, I want to apologize for how I made you feel. All the things I said were true. But I want to apologize for how ugly I made you feel, because I don't know what happened in your trauma that will make you participate in something so ugly. And whatever it was must have been worse than what was done to me, because I haven't been put in a place. I have not made a decision to go along with these terrible things. So the pain that you felt, ignored, or accepted affected you differently, which now allows you to do something beyond despicable. So I apologize for that. And I'm doing better, and I apologize. And it's time for us to take a look at the bad kids in our neighborhood that we consider bad kids. We made them kids. We made them. Everyone individually played a part in someone's life who we could deem friends and family. We made them that way. We're all part of it. So we got to forgive it. If we want to be forgiven for what we've done, we got to be ready to forgive them. And I'm saying, you as a man who has not forgiven, who's trying to, I've forgiven them by word, but my heart isn't always there. Talk to Vian, listen to her channel, because she's got some magic that she was able to do it. And I would recommend that if there's some people out there, if you can find people out there who are trying to teach how to forgive, start listening to them people, because they're going to be very valuable, very, 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 very valuable soon, because that's the trick. People who can teach you to forgive are going to be like IT, because if you want out of this shit, you got to let it go. And if you're holding on to this trauma, you can't ascend to your higher form. So I would recommend that you try to find people who have forgiven and learn from them. And in closing, I would just ask you to take a look at the next person, take a closer look at them. And I would like to acknowledge that I think the kings of the world, in my opinion, the kings and queens of the world, my opinion, if I had to put any people on a pedestal as the kings and queens of the world, I would put barbers and hairstylists as the kings and queens of the world. And I would like to say that if you're a barber, or if you're a hairstylist, nail technician, I would like to say that I don't think there's anyone on the planet more important than the service that you provide. And it's been minimized because we're in a society that doesn't appreciate people. But the barber and that hairstylist are counselors. And that's the only profession where 99.9% of the time that you deal with them, the outcome is always beautiful. You walk into a barber or a hairstylist or a nail technician's office feeling one kind of way, and you walk out feeling better about yourself. I think that's a beautiful, beautiful, beautiful character. You're a barber. I want to tell you that I see you. I appreciate you. You can look at me and just look at man, I can't get it. Man, and do I ever appreciate barbers right now? I haven't had a haircut. But these people who aren't seen in the proper light touch more people in a beautiful way than any doctor, accountant, lawyer, politician. They're the ones that speak to everybody in the community because everybody needs a haircut or get their hairs done or get their nails done. But most importantly, they make you feel beautiful. This is a career that has the most bodies of making people feel beautiful. No one can compare with how your barber and your hairstylist make you feel beautiful. And they don't have no ugly part of their job. They don't have to poison you to make you beautiful. They just make you beautiful and don't have to pay no wages to the devil for making you beautiful. Second group of people are who should be making decisions. Like if y'all gonna choose somebody who's a representative to make y'all decisions, pick a barber, a hairstylist, or a janitor. These are underappreciated people and occupations, but they affect your life more on a daily basis than any doctor, attorney, police officer, or politician. If y'all want people to tell you what to do because y'all indoctrinated and want to be led, find yourself a plumber. Let a plumber be in charge. Let a barber be in charge. Let a hairstylist, let a nail technician, let a janitor be in charge. The people in decision-making power should be janitors and barbers because they make you feel beautiful and they clean up your mess. And they're underappreciated, underpaid, undervalued. So let me just say that in closing. My shout out to the people who make people feel beautiful about themselves. Those are the most important jobs. Way more important than anything else. And I'm sorry this thing went long. I was a little triggered, got a little triggered today because forgiveness. I just wanted to say this because people can laugh at me today and laugh at me not having a haircut or my face looking swelled up because I'm upset. I'm looking like I'm looking weird. And they can laugh at that today. But I promise you, these things will matter in the future. And I promise you that the world ain't over, America is over, and we want it to be over. But America ain't a place, American is the people. And I go anywhere in the world, they like, you're American because it's my frequency, my frequency. Israel ain't a place, Israel's a people, it's a frequency.
Old America.
So
Old
this place
America.
that we're talking America, that's the frequency. And that frequency is dying. And every time something dies, something else is reborn. And we have the opportunity to be better and not want to be American, not want to be that frequency and want to be better and start over. But we can't start over without forgiveness. And if you haven't done it, no matter what you did, forgive yourself. Forgive yourself, the hardest one, forgive yourself. Forgive yourself and forgive others. Forgive yourself and forgive others. That's it.
Sure.
All right. If there's any comments or any questions, anybody want to cuss me out, Anybody want to
Okay,
fight with
let's
me?
see.
Anybody want to fight with me? Who wants to fight? Go. We can go through the comments. We want to say a special shout out to my man T Riggles. He's in the chat. We want to say a special shout out to my man Big Philly OG, Alkaline Avatar. Who's else in the chat?
Let's see.
Everyone who's here. I'm just gonna go over.
Yeah, I lost my message.
What's your message?
I was trying to
What you say? But I came first. Though. You gotta let me. The man makes the decision.
It's like the Petroleum man all over again.
The man
It's
makes
like,
the decision.
it's like everything
because
he talks
I'm
about.
first. Because I'm first.
But how
I
was
get to talk first.
Blake DeFeo. Let's see. Alaskan Avatar, T Wriggles, Aurora, Dawn Music, Leave My Rights Alone, Big Dog Philly OG, Open Third Eye. I think I got everybody that was here. Black Wild Indian. Okay, so let me see. Yeah, but same thing as woman. Yeah, but but the reason that I had started up this live was because I wanted to share with you guys, and this is flour all over my shirt because during this live, my son went downstairs and dumped out the whole bag of flour. So yeah, this is real. So that's why I'm so passionate about no. So that's why I'm so passionate about these hearings and things like that. But make no mistake, I'm fully aware of the orchestration of all of these things. And yet we still live in this world with these people, and they're the face of everything. So we have to pay attention to all of these things. And I know that within the conscious community, it's kind of like, oh, well, that world doesn't exist. And it's like, well, I mean, you can pretend and lie to yourself all you want to, but you are very much so a part of this system. And what they do, the choices that they make, affect your lives directly. So you're not going to agree with everything, but I'm trying to get the energy for you guys, if you're willing to put some energy towards going towards RFK getting the confirmation. I don't like the way that he's handled many things. Like I said, I don't agree with his stance with Israel. I don't agree with how his organization is run. There are many things, but I know that at the end of the day, the things that he is been selected for, not from us, not from anything, but the powers that be, he's the one that's selected to carry out the message. And I'm just saying, let's not. The vaccine is the biggest weapon, and I can be upset with him with his stance about Israel, but guess what? Bobby Kennedy can't do anything about Israel. He can't. It's bigger than him, that whole thing. But nothing is bigger than this, because the Israel thing is a horrible situation. It's an isolated situation. And we know that it's a religious, conflicting, fake outrage that they orchestrated to keep an ongoing biblical fight. Okay. But this thing that RFK is supposed to be in charge of is literally the only way that we will live. Do you understand what I'm saying? Like, the policies that get affected by the things that he's in charge of affect the entire world.
Takes away their biggest weapon.
That this is the whole world. This isn't just Judaism, Islam, Christianity. This is everybody.
For one world order.
Yeah.
The governments realize, hey, going to war is expensive. let's just get under one world order.
Right.
And we just keep the people sick.
Mm-hmm.
So the way we do that is we give you these things to keep you sick, because y'all ain't gonna be fighting no more because you're gonna be too damn sick to fight, because that's the new strategy. The strategy is
It's
tech
illness.
companies and illness.
Illness. Yeah.
It was war before, but this time it's illness.
Yeah. So that's I'll probably come on later once I get my thoughts back together. I got sidetracked and the kids and all that kind of stuff. But you know, just pay attention. Don't be played. You know, like I said, what's happening tomorrow, because I think tomorrow's the second hearing. What's happening, that this is what everyone should be looking at. And really, you really don't want RFK to get assassinated. You don't.
And it's set up.
You don't.
I'll do another video to show you the pattern.
Right. Yeah. So we'll probably come on later on today or something like that, to show you how they're setting this whole thing up. But y'all, we've been here for 5 hours. Thank you guys for being here. And like I said, we might come back later. Okay. All right. All y'all be safe. Can you dig it?
Today.